Vice Chair Palomero has requested an excuse. Chair Bell,
Here.
you have a quorum present.
Thank you. Next item, please.
Approval of the minutes from the October 1st, 2019 meeting.
It's been moved and supported. Any changes, deletions to the minutes? Hearing none, all in favor say aye. Any opposed? Ayes have it. Next item.
Unfinished business, there is none listed. We are moving to item D1, approval of the Wayne County Jail Mental Health Initiative Resolution.
Okay, if I could ask Judge Burton to come to the table, please. Thank you, Judge Burton. Good morning. So this is something that Judge Burton and I and several different people throughout the county have been working on. Last year, I mentioned that we went to look at the Miami-Dade, how they're doing their mental health and diverting people out of jails and how they've really shrunk their mental health in jail population. They've been at it for over 18 years, and so it's not overnight, but since this time, they've become a model in the country on how to reduce their mental health and substance abuse population out of the jails, and to really have a state-of-the-art system that's gotten awards and all across the country on how they've been able to save lives, save money, and have a better, more comprehensive system. So Judge Burton and I, along with Judge Kenny, the Sheriff Department, the Mental Health Authority, 36th District Court, DPD, several partners have come together because in the past we've all kind of operated in a silo, but now we're working together to move the county forward with this. So with that, I would like to ask Judge Burton if he would speak about what we're doing with the Wayne County Jail Mental Health Initiative, and then in our packet we have a resolution. So Judge Burton.
Yeah, right there.
Can you hear me?
Yes.
I'm technically challenged. I will acknowledge that right away. Thank you for the opportunity to come before the commission. I'm always honored to have the pleasure to do so. Those of you who know me know that I was on the commission 1,000 years ago for about 4.5 years, and always very much enjoy coming back. That's right, your district, number 2. And so the chair is absolutely correct. We have pulled together a collaboration of actually some 45 stakeholders, not just to mention the ones that we've talked about, including Mr. Brooks and Chief Judge Kenny, who is really the one who had the idea to pull this together. But actually, I really want to applaud this body, because you actually kicked it off, I think, in 2016, Madam Chair.
2015?
2015 with the Stepping Up Initiative. It's a national initiative that's designed to divert people who suffer from mental illness from jails into settings that are appropriate and that will provide assistance to them. What we're doing here in Wayne County is a lot of that, except we are now, as the chair has pointed out, collaborating. We're coming together. And I welcome any questions that you have about what we're doing. This resolution has been developed because we're getting a formal commitment from every single stakeholder who's involved as we go forward. I would also note, too, that you have provided us with Tim Johnson, who has helped name this organization and provide the logo for it. I think that they're in your packets. Yes, just developed. You'll start seeing it a lot more, and that's the Wayne County Jail Mental Health Initiative is what we're calling ourselves. Any of us are available to answer any questions. If you're interested and want to really see the result of where we're trying to go, we're 2 years in. Miami-Dade County is the model we're using. They're about 18 or 19 years into their efforts, including the development of a possible crisis center, which we think is critical for the county of Wayne going forward. So I strongly offer a request to you that you approve this resolution so we can formalize your involvement as we go forward. And at this point, I'll be happy to answer any questions that any of you might have.
Okay, thank you. list Commissioner Anderson and Commissioner Basham.
Good morning.
Good morning.
I just wanted to ask you a question. I'm assuming there's even a savings for not only we're getting mental health to people that need it rather than just locking them up, which in itself is a huge benefit, but I'm assuming there's a savings between them being in jail versus getting the treatment they need. Is that?
Eventually, what we've seen across the country actually is that there's a reduction in the number of people that are actually going to jails. But we have a critical need for that. We have a critical need to make sure that the people who should be in jail, we have a place to send them. We expect that we'll shift a lot of our resources towards helping people who are suffering from mental illness. Instead of putting them in jail, we're going to be using those resources to instead get them the assistance that they require. It's a really important component of what we're advocating. And so you're absolutely right when you raise the question about saving money. I think we're better utilizing the funds that we have available, consequently, by getting people the assistance that they need. An example is that we don't have to put people in hospitals necessarily for any significant period of time or put them in jail. We can instead get them on the right road to recovery and to take care of their families, which is really a tremendously unsubstantiated, uncalculated expense that we're still working on. I hope that answers your question.
It does. I believe, though, and this is probably, correct me if I'm wrong, this is a plan to make sure those that are already incarcerated are getting the kind of treatment that they need as far as mental health treatment.
Even before, the idea would be before that they're diverted prior to going to the jails, that's the main thing. We want to make sure that they're going in the right place at the beginning of the system and not after they've already been in the system.
And I think a big part of that is probably part of this plan is that making sure law enforcement realizes or recognizes, some things that will help them make sure they do get diverted into this program rather than locked up.
Absolutely. You want to talk about the
Be
training?
I'll be happy to not only talk about training, there is a crisis intervention training that is being presented to police officers. Additionally, the probate court handles transport orders. That is, a person can come in off the street and say that this person won't take medication, they need treatment for the illness, and they present a substantial danger to themselves or to others. And the court will sign an order and present it to the police. The police will then take that order and pick up the person to transport them to the hospital. Well, we're only open from 8 to 4:30. So what happens at night? What happens in the middle of the night? Well, we're in the process of putting together a transport order plan that will allow circuit and allow district court judges as well as probate judges to be available on a 24-hour call basis so that we can execute these documents and transport these people to hospitals instead of to jails. And it's working. And it's still a problem, though, I'll say this. The largest mental health facility in Wayne County is the Wayne County Jail. And that's an absolute disgrace. And so we're moving in a direction that eliminates that particular issue and gets us on the right track. And again, whether you know it or not, this commission has been a real leader in this effort, particularly by way of the chair and by the way of your participation and the questions that you've raised over the years and the willingness to participate.
Is there one last question and then a comment? Is there any other county system, courts and jails or sheriff's departments that are doing this already?
There are 8 in the state of Michigan that have been discussing and working on this plan. We, though, decided that we would try and swallow the elephant whole by taking on Wayne County as the top one. And I think there are a lot of people around the state looking at this program to see if we're going to have success. And with your commitment and your support, we expect that the people of Wayne County are very, very pleased with the outcome. But it's going to take some time, and it's going to take some money and patience.
Hopefully it'll reduce the recidivism too. That's,
when-
it should be a large benefit.
When people go to jail who suffer from mental illness, the recidivism rate is out of this world, and because they stop taking the medication as soon as they're released. And what we're talking about is getting them into an environment where they can transition and get used to taking the medication. Sometimes patients will tell you that the worse than the illness is the medication. We hear, for example, tardive dyskinesia, which is you see the sudden movement of the face and the twitching of the muscles in the face. It scares people. It scares the people who have to take the medication. But the reality is it's a necessary part of stabilizing their condition. So we have to educate people. We try to remove the stigma of mental illness. And I think we're making some progress. But it's going to take time and patience. It's a heavy lift, but it's well worth the effort.
And the last thing I'll say is that when I was in the Senate and there was a new corrections director that came in, he came to my office and I was surprised that he became a huge advocate of dealing with the mental health issues that resulted in the population just exploding in prison. And he was brand new. He was a sheriff, I think, when he came in. This was during the Snyder administration, and he mentioned the percentage of people that were in prison that had mental health issue.
Even though the prison population is going down, the number of prisoners in the jails is going up. It's now 23%.
Well,
Which
thank
is
you
just
for-
not acceptable.
Thank you for your work on this.
Thank you.
Thank you, Commissioner. Commissioner Basham?
Thank you, Madam Chair. First of all, let me just say, before I make a couple comments, that I fully support this resolution. But I do have some questions, and my questions are, because of my previous experience when I used to work for a living at Ford Motor Company, I was an employee assistance rep, and I put people in treatment for mental health and substance abuse. And I even was able to accelerate the admission process with the local hospitals. And I did that for about 8 years. But what I also found out, that there's a difference between detox and treatment. And if you want recidivism, then you just detox and turn them loose. If you want to fix the issue, then you got to treat them. And we had 28-day programs that when things started getting tighter with Ford Motor Company, they eliminated the treatment program and you started seeing the recidivism again. So I'm saying that even though I support what you're doing here, I think we should go further and actually look at, if you really want to save money, sometimes you just can't cut your way into savings. You got to actually invest. And one of the ways to invest is if, in fact, these people meet those qualifications, then let's not just treat them. And if they got a history of X, Y, and Z, why don't we put them in a 28-day program? Because we have the mental health folks sitting at the table here who could actually probably work with us on that. But
Yeah,
do you support that?
I completely support that.
Write that down.
That's going to, you got me on record. But it's also, it would necessitate some further modification of mental health code.
Yes.
Meaning the legislature would have to be contacted. But it's absolutely right. What we see in Wayne County Probate Court and what police see when they pick up persons who obviously are suffering from mental illness is this incredible revolving door where it's just not working. This is what we're trying to eliminate. We're trying to make sure we give people an opportunity to get settled in, to get used to the medication, to get a place to live, to be able to do something that's practical so that they can avoid this horrible cycle that exists. And by the way, it's not just in Wayne County or the state of Michigan, it's all over the country. And it's just not, it's not acceptable. And the interesting thing to me is that every place we've gone where we've presented, everyone agrees. But it just takes a group of us to actually be focused. You're lucky that you got a chair who is actually focused on this and is really going to push it through the county and help us push it through the county. But it is a very, very difficult lift. But it's time, and I'm really impressed with the fact that while we have a number of silos, as the chair mentioned, people are willing to come together. They're starting to talk. Just in this room alone, we have the executive director of the Detroit Wayne Integrated Health Network, Mr. Brooks, and we have the chief judge of the Third Judicial Circuit Court, Tim Kinney, who really called me one day in January 2018 and said, "Hey, Freddie, how about we work on something like this?" Well, The two of us are kind of joined at the hip, and now we've gotten Willie to be joined at the hip, and the chair to be joined at the hip, and the county executive to be joined at the hip, and we're working very hard together. I strongly suggest, one final thing, that if you have an opportunity to go down to Miami and to have a day just to go over and look at what they're doing, I think you'll come back fired up and really very, very interested and motivated to go forward. And I'll be happy to help get that schedule for you if indeed you wish to go.
And their crisis center, I think, will be completed in about another 2 years, and it was federally funded too. So we need to talk about how they were able to get the federal dollars to convert. It was an old jail, and they converted an old jail to now it's going to be a crisis center. So, and how they were able to get that funding together. So it's a well worth getting more information on how they did what they did. Again, it didn't happen overnight. It took them some years, but they are now at a place where they're a model for the entire country. So,
That's right.
thank you. Okay. Thank you. Commissioner Dobb.
Thank you, Madam Chair. I was actually fortunate enough to tour the Miami-Dade facility that they're working on when we went down for the large urban county caucus with the National Association of Counties. So I really did like what they were doing down there. And my question is our model going to be the exact same as theirs? And if not, what are the differences that we're doing
Well, we have
up here?
part of collaborative effort means that we've got to be flexible. The model is the Miami-Dade, but there may be some things that some of the collaborators that we have are doing differently. That's why we're bringing this memorandum of understanding together, so we all understand what we're doing, and that we're all moving in one direction. That is to make sure that people who suffer from mental illness aren't simply put in jail because they're mentally ill. If they're in jail, it's because they're violent or they're dangerous, and that we want to make sure that the rest of the community is not harmed. So this is all about nonviolent offenders. And so I expect fully that while it may look a lot like Miami-Dade, we have to be flexible in terms of making certain that we have Wayne County has different needs than Miami-Dade. They have a different funding source down there than we do. And so we have to, ours is actually kind of a judicial effort. And we've learned as judges that if you call a meeting, people show up to who knew, but they do show up and they participate and they get involved. But we really think the Miami-Dade model is the way to go.
Okay. One of the things that I really liked about the Miami-Dade model was the peer-to-peer counseling portion of that. Would we be having that
Absolutely.
as our-
We call them navigators here in Wayne County. I would love for you to have had an opportunity to meet a gentleman who was an actual peer, who's been through the program. He's actually been a drug addict. He had mental illness in his family, and when he hears that someone fails to, say, make their pickup from the community setting, he will get in this old raggedy car. They finally gave him a better car. And he will chase them down, pick them up, and he can talk the language and get them there so that they don't fall off. And so he's tremendously valuable. But we expect, and we already have navigators through DWIN that are providing great assistance along those lines. But they're absolutely invaluable.
Okay, great. Where can we get more information on exactly what will be included in the
From me?
model? Yeah.
From me.
Oh,
I'll
from
make
you?
sure that
Okay.
Michael McClory is a staff attorney with the court. We'll make sure we provide that information to each and every one of you if you like.
Is there anything online for the public to look at this point?
There should be, but I can't tell you. As I mentioned at the top end, I'm not the techie one in the room, but I'll make sure that we get the information that you need, and including, and certainly Miami-Dade does have information along those lines. Tim, have I missed anything?
No, you haven't.
Willie, missed anything?
Judge Kenny, I'm sorry, I didn't know you were. You can certainly come up. Yeah. Is Judge Kenny in the room? Oh, hey, Judge, come on up. Come on up, Judge. You kept referring to him and looking at the chair.
No, where is he?
Is he bringing me my audit, Madam
I
Chair?
wanted to be there.
Come on up, Judge
Don't call
Kenny.
me out.
Thank you. Actually, it was, we were in
such good hands with Chief Judge Burton that I wasn't inclined to spoil the momentum.
No, we thank you for coming. If I'd seen you there, I would have had you come to the table as well, sir. So-
No, thank you. I knew that Judge Burton was going to be coming and making the presentation, and since I knew it was in great hands, I was happy to hear what was being said. I would just like to follow up a little bit on the last comment in terms of whether or not our particular project is going to be exactly replicating what was done in Miami-Dade, and the answer to that is no. And what we've done is we have taken a look at what have been the great ideas that Miami-Dade has developed over the past 19 years, and we've appropriated them. But their system, their criminal justice system, is somewhat different than ours, so that it's not something that we could just layer our program on top of theirs. But they have been the first to admit to us that for our being 2 years or so into the application of our particular project, we have come a long way faster than they did. So I think that, as Chief Judge Burton has mentioned, we've really made tremendous progress.
And in fact, if I could follow up on that comment, they visited Detroit in September of last year, and they were, I think, very well impressed with the progress that we had made, and were very encouraged, and actually, I don't know how they could take away from what we've done but in terms of ideas, but they certainly seemed very happy to know that we were mirroring pretty much what they're doing, but as indicated, not completely. We have our own things we have to deal with here in Wayne County.
Very good. And Commissioner Dobb, you do have this packet here, and this kind of goes through the steps and what we're going to be doing, the beginning steps of where we are and how we're going to move forward, so.
Thank you.
Commissioner Killeen?
Thank you, Madam Chair. Judges all, good morning.
Morning.
See, it's a resolution before us, so there's a lot of fill in the blanks to go yet, right? So what we're saying is general direction here is where we're going to go. And Commissioner Dobb, we do have over at the Mental Health Authority, we do have a contract with Northeast Guidance Center, and we're training frontline police officers. But, you know, it's a matter of money, so that people can divert right when they run into somebody on the street. And, you know, like with teachers, we're putting more on police officers to make calls like that. And also peer-to-peer counseling is a bedrock both in mental health and with our substance misuse providers that they use, but it needs more money, needs more. So we need to go down this road, but I'm looking, Madam Chair, I think the commission needs like a regular update, because, you know, you've already mentioned, you know, maybe we need federal money because we do need the center. You know, what is the state going to put into this? What are all our, you know, where are we going to find all of these dollars? And so I think as things develop, that there should be a mechanism through the commission to get reporting back to all of the commissioners where we're at, either through committees of the whole or maybe having reportings come through Health and Human Services Committee, so that as the pieces start falling into place, that we're staying up on it, and because it is going to take money.
Sure.
And reallocation of money. And then, okay, how much is the Mental Health Authority in on this? How much are county dollars in on this? How much are court dollars in on this? And you've referred to possibly taking an amendment to the mental health code, and that's its own little process up in Lansing.
Yep.
So my main concern right now is, Madam Chair, is that we have a conduit back to the commission, so in whatever form, so the commissioners are getting a regular update, and that we keep moving in this direction.
We
So-
can certainly, if it's not a problem, Madam Chair, we can after, we have a meeting on a
We'll
monthly,
fit-
on a monthly
okay.
basis.
Yeah.
And we'll make sure that,
Quarterly.
because we'll make sure that each of you gets a copy of the minutes and gets a copy of what we're doing going forward. And we're fortunate that your chair has attended a number of the meetings, as has Tim Johnson, and can share additional information with you.
But I also think from time to time, paper is good. We'll get that on a regular basis, but from time to time, to have a real person in front of real commissioners, chance to ask questions.
Always available.
Okay.
Yeah, we can
Thank
do
you.
that quarterly because we do meet, like I said, monthly. So every 3 months, we can give an update. And Health Human Services probably will be the initial mechanism. And then maybe twice a year, we can have a committee of the whole update. So, thank you. Commissioner Haydes.
Thank you. Thank you, judges, for being here today. This issue been painful to me for a long time because I mentioned in the full board meeting in 2015 and 2016 it's a shame for civilized society to consider illness as a crime. And there was a question by my colleague Anderson is on the saving. Is that going to be saving on this issue? Mentally ill person was repeatedly released and going back to the system, averaged by 6-7 times. Put them in the jail. It's a happy day for me today to support movement like this, to make sure we treat the mentally ill people as a ill people, not as a criminal.
Right.
Are we gonna need to adjust what we're doing as we going? Yes, I hope we will have a perfect system that it's not gonna reduce the cost only. It would reduce the crime that caused by mental illness. I'm in support of this. You got my full support, and I hope we doing the right thing from now on. Thank you.
Could I just give you two quick anecdotes? I think one will talk about sort of the savings that can arise, and also another example that I think alludes to the notion of just getting people back being healthy and productive and contributing members of the community. One of the component parts of our joint program here is a program where we are taking a look at those individuals who come into the Wayne County Jail on nonviolent misdemeanor charges, who happen to be mentally ill. I think we would all agree, somebody who goes into CVS and still steals a big bag of Snickers and happens to be mentally ill shouldn't be in the Wayne County Jail. And what we have done through the assistance of the Navigator program that the DWIN has provided excellent resources for us, together with assistance from the Sheriff's Department personnel. We are identifying those individuals when they come into the jail, and within 48 to 72 hours, getting them identified, getting them out of the jail, getting them connected with a mental health provider, having the Navigator make sure that they keep any other appointments, whether it's a medical appointment or whether it's a court appointment. And we are having some real success. One quick example is somebody who came into the jail about a month ago, happened to be a longtime Chrysler employee, was off his medication, having mental health issues, ended up on an ordinance violation in the Wayne County Jail, was identified, got back on track, got reconnected with his mental health provider, and now he's back working at Chrysler. He didn't lose his job, he's connected, he's doing the right thing. That's a wonderful thing. To the cost issue, as explained by as raised by Commissioner Hattis. There was an individual who's in his mid-50s who came through the Wayne County Jail over the last 15 years on mainly misdemeanor charges, 43 times. Now, I'll tell you, there's no judge anywhere in America who wants to push that revolving door. Well, that particular cost ended up costing, just to keep him in the Wayne County Jail over that time, hundreds of thousands of dollars. It's an incredible waste. But fortunately, through this program, we were able to get him identified. He was able to get connected with a provider. Turns out he was a veteran. He was in the early stages of dementia. He's now in an assisted living facility. He's getting the kind of treatment he deserves, and he's out of the criminal justice system. So those are two examples of the kind of collaborative effort that Chief Judge Burton talked about that I think is helping us move forward. I do think, in fairness, that while we are going to be able to talk in some instances about savings, I think we should also recognize that to a considerable extent, we're going to be shifting resources, not just talking about saving dollars. It's going to be shifting resources toward health rather than toward incarceration. I think ultimately, and I hope that the data will prove us right, it will show you that this is a resource investment that is well worthwhile for all of the residents of Wayne County.
Yes, thank you, Judge. I'm glad you mentioned that. We'll be shifting our savings, because that's the important part of this, on a more preventative and health basis. So thank you for that. Commissioner Monique Baker McCormick.
Thank you, Madam Chair. And so, I've been pushing jobs, not jail. So this is really important to me to make sure that we help those that need help. And so the resolution talks to working with community partners. There's an organization in my district, Life Challenges Ministries, that does a lot of the work that we're talking about today. And so I wanted to see how we are working with various organizations in the community to maybe get the word out. Is there a one pager that we can put out in our community, in our newsletters? And in particular, I also work with the veterans and veterans groups to maybe get that information out as well.
Commissioner, first of all, our door is always open. We meet, as I indicated, monthly, the third Tuesday at 2 o'clock on the 7th floor of the Coleman Young Municipal Center. What room is that, 70?
It's the conference room, 705.
705, thank you. And absolutely are welcome to come. Ours is an open door policy for the purposes of making sure people understand what we're doing and that they can also participate in what we're doing. Again, we haven't heard not a single peep out of anyone that does not believe that this is important work and that they're willing to dedicate themselves to it. You talk about money, and Chief Judge Kenney is absolutely right. Shifting dollars is actually what will happen. But for now, how do we actually get moving? We've been able to get a grant from the Flynn Foundation, and we have project managers. They're on board for 2 years. They're about 6-7 months into that contract. We're going to lose them in a year and a half. They're absolutely critical. They're with the Wayne State University School of Social Work. They call it the Center for Mental Health and Justice. They have really talented, fine people who are helping us compile the data that we need to have. They're helping us to reach out and have contacts. They have been involved with these 8 other counties in terms of getting this kind of program up and running. And so I certainly welcome and you and anyone from a community organization to come forward, participate, look at what we're doing, tell us where we need to change, what we need to fix,
Great.
and so that we can go forward.
Great. And then the other question I had is really looking at the state's role and how we got here, because they closed all of the mental facilities to help those that needed it. So is the state at all involved at this point?
Yes, Dr. Deborah Pinos, who's a psychiatrist, I don't know if most of you know her. She is responsible for the behavioral health department. They're working. She's part of our group. She went down to Miami with us. She is a part of our executive committee. She works with us on a regular basis. But they're being pulled in different directions right now. I had an opportunity to meet with Robert Gordon, the new director of the Department of Health and Human Services, recently, and he is moving in a direction that I think your leadership would provide him some benefit. So I hope you'll reach out to him and to talk with him, so that he's new to our state. He's a Harvard University graduate, Yale graduate law school, and a former appointee of President Obama. But I think that he needs to hear from us in this part of the state so that he can understand exactly what we think ought to occur and what the state's involvement should look like going forward. I think he's a fine person. He just needs to talk with some of you to better understand how to proceed.
Thank you.
Thank you. We'll get some material for you, Commissioner Baker McCormick, working with Tim and the judges for some one-pager that you can pass out to your community and for all of other community organizations. Wrapping up this conversation, our last speaker is Commissioner Killeen.
Yeah, thank you again. For a second one, Madam Chair, I just want to briefly mention, on the issue of savings, yeah, there's going to be some savings here and there, but it looks like we got big capital costs coming. So from my perspective, to get the right thing done, you spend the money. It's not just, is there savings? But Judge, you just touched on it a little bit, and as far as the state of Michigan goes, as a lot of my colleagues, I've been reporting on this last 3 or 4 years, this 298 process that's been going on up in Lansing. There's about 2.7 billion of Medicaid dollars that come to Michigan for mental health. And there's a real big battle going on up in Lansing about how those dollars are to be spent. It's going to involve whether there's the private for-profit health plans are going to come in and run things. Is it going to be the public system? And Mr. Gordon indeed needs our help. So 298 is off the table now, but the term is SIPS, S-I-P-S, I forget, statewide, something. And that has the proposal that the Whitmer administration has put on the table has had a lot of pushback. And I don't know if my executive director at Detroit Wayne Integrated Health Network is going to mention this, but that's also going to be a real big part because there's some unknowns here in terms of what the direction the state is going to be taking. So there is a lot of tricky twists and turns here yet to go, but I will be reporting back to you on the Medicaid dollars and how that stuff is going up there. But there's a lot of trickiness as people are deciding how to allocate these funds. So we do need to stay engaged. I'll do my best. I'm a treasurer over at DeWin, to keep my colleagues up to date on this and the conversation that's going on in Lansing, because I think we have a few people around the table that have been in Lansing. So that's going to be another very important thing here is to, let's say, help the governor get this right in terms of the allocation of those Medicaid dollars. Thank you, Madam Chair.
Thank you. And let me again thank Judge Kinney and Judge Burton for your leadership on this. We've been working on it for a few years now, and it's great to see it come to fruition and moving forward. So I thank you for what you've done, and we will see you again. This will not be the last time you'll come before us as we continue to do great things in this space. So thank you for your time and your efforts,
Happy
and
to
we
come up.
appreciate you coming out. I guess it's time to get back to your courtrooms, huh? Thank
right.
you so much.
All right, thank you all.
And before I ask you to leave, I think Judge Kinney, you're going to stay for our next item.
I am.
So you can stay where you are. Thank you, Judge Burton. We appreciate you. Yeah. Now, this is a action item, so is there a motion to approve the resolution?
So moved.
Is there support? Moved and supported. Any discussion on the resolution? Hearing none, it'll be at our full board meeting on next week. Oh, I'm sorry. All in favor, say aye.
Aye.
I jumped the gun a little there. Any nays? Okay, now it is moved, and it'll be on our agenda next week. Thank you, Judge, again for coming out. Appreciate you. Thank you. Next item, please.
Item number 2 is the discussion with Wayne County Deputy CEO Richard Kaufman and Third Circuit Court Judge Timothy Kinney regarding the Third Circuit Court Clinic Agreement.
Thank you so much. Some of you may remember a few years back, there was discussion about the Third Circuit Clinic and whether to close it, what to do with it. There were some funding issues. The chief judge at the time had conversations with the CEO at the time, and we were just going back and forth on what to do. I'm glad to say they have come to an agreement with that clinic that will benefit the patients and the persons who visit the clinic as well as financially. So given that general backdrop, I'm going to turn it over to Judge Kaufman and Judge Kinney to discuss what will be coming before us formally, but this is the discussion piece as we await the formal documents to be transmitted to us. Judge Kaufman.
Rick Kaufman, Deputy County Executive. Let me start by thanking you all for calling Judge Kinney up for the last item, because I was spending 20 minutes over there calming him down that you didn't think Judge Burton was more important than him. First, you put Judge Burton's item ahead of his, and then you ignore him for the second item. I assured them that had no reflection on how you view Judge Burton versus Judge
Kinney knows we love him.
He's a big help.
He never showed me my audit report.
Okay, thank you all very much. Yes, this is the conclusion of a long story. I've tried to put the whole story down on one page in front of you, and I'll just go through the highlights of it. Prior to February of 2018, there were 2 places in the county that acted separately to try to provide services for juveniles at risk. One was the Wayne County Juvenile Justice Program, where eligible youths would come into the program and we would evaluate them and often assign them to treatment to CMOs. The other, which is a match program with the state, the county paid 50% of the cost of the program. And the state child care fund played the other 50%. The second place in the county was the Circuit Court's Clinic for Child Study. And they were funded, I think exclusively by a grant from the Mental Health Authority, which is now D-Wing. And for decades, I think, they were getting a grant of $4.6 million to run the Clinic for Child Study. In February of 2018, the chief judge of the Circuit Court got a letter from MHA saying, we're slashing your grant. It kind of said you'll still have 1.2 million, but the 1.2 million was not even assured because it needed to require compliance with certain Medicaid rules. So at most, it was going to be 1.2 instead of the 4.6, and it could have been a lot less than that. What ensued was a little over 2 years of lots of struggle between the county exec's office and the circuit court in trying to figure out how we could fund this and still provide services to juveniles that need it. But losing 4.6 million is a lot of money to lose. We were able to get stopgap funding while we were trying to come up with some solution. And frankly, we didn't make any progress until the Wayne Circuit Court got a new chief judge named Tim Kinney. Tim looked at this with new eyes And he led an effort that took about 6 months to 9 months to look at these two independent entities that were doing basically the same thing and figure out what's the best way to serve the juveniles and their families that are being served by both of these entities. He led an effort with some of his staff people, some of the county staff people. He went to Wayne State and talked to the experts over there, conducted many, many meetings. And through his leadership and help from a lot of other people on our side, Shanetta Coleman and Jeanette Allen and Brian Manning, and later on our accounting staff with Kamal Kemperu, I think, and our new CFO, Huey Newsom, spent months, lots of meeting and time to come up with a merger of the two entities, coordinating, deciding who does one function, who should do another function. And the result of that is that we are on the brink, April 1st, starting this new program that we are all very excited about because we think it is state-of-the-art. It will provide better treatment and outcomes, we think, to the juveniles at risk that we are going to serve, and, not that it matters to me, but for a substantially less cost. The $4.6 million that went away, you can see at the bottom of my one page what we need to continue to start operating this on April 1st, because what we did with this year's budget is we figured out how to keep running what we were running until April 1st. And that was part strategy. Judge Kenny said to me, we got to put a deadline on here. We are making major changes in government that don't occur a lot of the time. Not everybody's going to be happy with these major changes. If we don't put a deadline, we'll never get it done. And we're using just about all the time for that deadline. So we're all optimistic to get this thing running. The amount that we're asking you for, or really it's a budget adjustment to take our agreement with the circuit court and allow the county part of the expense for the next 6 months to come from the Wayne Circuit Court's fund balance. And based upon the state rules and our discussions with MHA, you can see who's responsible for the approximately 1.3 million we need starting April 1st to fill out the budget year. You may ask, well, what happens after September 30th? And the answer is we got to schedule another meeting because our 4-year agreement with the county's agreement with Circuit Court to operate their whole budget is expiring, and we're now negotiating to come up with an overall budget, which will obviously include this.
All right, so that was a lot. So there may be some questions, and I wanted to have it today as the initial discussion piece. We'll decide how we're going to move forward to get this through as an actual item on an agenda, either the budget adjustment on an emergency Ways and Means meeting, or it'll take its course, which means our first meeting will be April 2nd, so that it may have to be retroactive. But we'll work on those details. But I wanted to have this item before all of us because it is a change to how we've been operating. So Commissioner Killeen, questions?
Could I, excuse me, Madam Chair, could I make a few
Absolutely.
Comments as well, adding to what Judge Kaufman mentioned? When I took over as Chief Judge in January of 2019, quite frankly, I didn't know a great deal about how the juvenile court operated, especially with regards to the Clinic for Child Study. And one of the advantages, if you will, about being new in the position that I was in, it gave me the opportunity to sit down with some very experienced and very knowledgeable people and ask them, why do we do things the way we are doing, and how long have we been doing it this particular way? And recognizing the kind of economic challenges, as Judge Kaufman alluded to, it really, I thought, presented a circumstance for us to take a brand-new look at how we do juvenile justice. Is there a way that we can do things better, given the resources and the talent that we have? There are a great many people working for the CMOs and the CMHs who are doing wonderful work and helping. We have very talented people, excellent, experienced, devoted people working in the Clinic for Child Study. But it just was not a system that could continue to perpetuate. I should also tell you, many of you know, that I was the presiding judge in the criminal division for 9 years and spent a lot of time as a judge over there in Frank Murphy. And in the Frank Murphy Hall of Justice, we saw far too many alumni of the Lincoln Hall of Justice ending up showing up 3, 4, 5 years later in the Frank Murphy Hall of Justice. So the question is, can we or should we be doing something earlier on with individuals who come to the Lincoln Hall of Justice when they're 13, 14, 15 years old, who are going to keep them out of the adult criminal court when they're 19 through 25, that age. And one of the things that I learned was that what we have done for decades and decades has been we would do an assessment of the needs and the risk of juveniles after the case had been adjudicated. In other words, after the case had been tried or there had been a plea, then forces would come together to determine what exactly are the needs of this particular juvenile and going forward. And after meeting with a lot of the experts and getting the stakeholders around the table and everybody freely discussing what their viewpoints were, we came up with the decision that we should be doing this earlier. And so this particular program is one that as soon as a delinquency petition is filed against a juvenile, there's going to be an assessment done. And it's one that is a valid state-of-the-art assessment tool that's going to be administered by the clinic. Instead of doing the therapy work and doing the counseling, that's going to be left to the CMOs who do that well. But the skill set that the clinic brings is certainly well suited to doing assessments. And if we do the assessments early on, one of the advantages is not only will we be able to see who's in need of services, but who may not need a lot of services. Because given the funds that we have, we don't want to underserve those who really need a great deal of services, and we don't want to overserve those who really may not need a whole lot. The other thing that I think that is important for us is that this assessment is going to give us a window and an insight into what kind of family needs may be out there that could be addressed early on. It's no secret that many of the juveniles who come to the Lincoln Hall of Justice on delinquency matters are going to come from families that are deeply troubled. Now, if you have a situation where perhaps there's substance abuse problems, or maybe there's mental health problems that are in the family, the earlier we have the opportunity to reach out and extend the opportunity for services to the family, the better it is for the juvenile, it's better for the family. There may be other siblings in that house. So if there are other siblings and we can deal with services for the family, that will then maybe keep a number of the other siblings from coming to the Lincoln Hall of Justice later on. We have been working closely with the Wayne State Center for Behavioral Health and Justice. They are going to be providing us with an assessment and an evaluation of how we're doing, which I think will be very valuable, so we'll know how the county's dollars are being used. Are they being used wisely? And I also want you to know that once the judge imposes a recommendation for treatment and counseling and therapy and whatnot, the people from the Clinic for Child Study who do the initial assessment are going to circle back and do an assessment for that judge so that before that person is released from probation, the judge will know whether or not the services that have been rendered thus far have been sufficient. It may be the kind of situation where maybe the person went through the treatment and the counseling, but maybe they need something additional. Maybe they need 3 more months. Maybe they need a little bit more time. So we think that it's innovative. Our work with Wayne State, I think, shows that we are going to be a cutting-edge program going forward. I think not only will it benefit juveniles and families, but I think it will place Wayne County in a position where we will be a leader on how to improve juvenile justice. That people throughout the state will be able to look to Wayne County as to how to do it right. Thanks.
Thank you, and thank you, Judge, because sometimes it does take fresh eyes to look at an issue, to come up with some solutions, and look like you all have done that. So I'm thankful that you were able to come up with something that's going to benefit our juveniles, which is the most important person. So I'll go back to our list that we have. Commissioner Killeen, did you want to be taken off, or you? I had you crossed off. Go ahead, Commissioner Killeen.
Thank you. Yeah, I just wanted to mention a couple of things here. I'm so much in support of this. Along with the state getting out of the mental health business and closing Lafayette back in that time, the county also took over juvenile justice at that time. When the state was kind of running it and we were sending people to like boys maxi training, turning them into real criminals and bringing them back here. And that's when the county set up the CMO system, and some of our newer colleagues. We have 5 of them, and I'll mention at the Health and Human Services report next week, the 5 CMOs and the adjustments to their budgets are on there. So you can look, Black Family Development, you can see who the nonprofits that are delivering these services. When the state was doing this prior to the county with the CF, because we're already a leader, and now we're going to make it better, prior to the county running the juvenile justice system, we had recidivism rates in the 60, 65, 70% rate with juveniles. With our CMO system, we drove that down to like 8, 9. Now, with our own budgets, there has been a little erosion of that funding for the CMOs, and this commission and previous commissions have really stood up for this. But when there's a slight erosion of funding, you see recidivism creep back up a little bit. I think we're at about 13 or so, but we have done an excellent job in the county, and we do need to improve it. But I also want to say, given our last resolution that we passed, where, it was referenced the different silos that are out there that have money that are spending on these things, and you see the decision that DWIN had to make for their own budget a couple of years ago, of eliminating the 4.6. So this is why I'm glad we have a collaborative sitting around the table with the different silos so that people aren't just making their own individual decisions for their budgets, and then that puts a burden on somebody else. So I'm really glad that we have that. And I must say, Judge, I have very much appreciated your leadership on this over the years, because I get to see it through DWIN and my involvement on the board. So this is all to the good. And we have learned, like with seniors, do not incarcerate, do not institutionalize seniors. Keep them in their homes, bring the services there, you get better outcomes, and it turns out to be cheaper. And we've learned this with the juvenile justice system too. Don't incarcerate them, don't put them in there. Keep them in the community, keep them in their home, bring the services to the families, and that would include some mental health services. And it's better outcomes for the family, it's better outcomes for the traffic in the courts, less incarceration. So the more, and I appreciate we keep moving down this road. So I'll leave it at that. Thanks, Madam Chair.
Thank you. Commissioner Haydos?
Thank you. It is a great day, because with those 2 resolutions today, it shows we trying to do the right thing. I appreciate the hard work you've been doing on this. Just if you could explain to me a little bit the relationship between the district court and the circuit court and this issue with the juvenile, because I know there's some work been given to some district court on the juvenile issue?
Yes, we have not touched that, Commissioner Haydes, with regards to the fact that there are several communities that are handling delinquency matters in the district court. We have, depending on what numbers we project, it's somewhere between 2,600 and 3,000 delinquency petitions that get filed through the Lincoln Hall of Justice. That's sort of the big target that we are dealing with right now. I think that the other district courts that have some existing work right now, that's probably sort of the second chapter of what we need to reach out to. Certainly, we don't want to leave anyone behind, but in terms of where can we have an immediate and direct impact that can change lives, we figure that this is the best start.
Thank you.
Thank you, thank you. Commissioner Marecki.
Thank you for all the work you did in this. I remember when I first came on board here, hearing about that program in the past, and it was very concerning, all that money, and seemed to be in disarray, so I appreciate the work. I do have a question, though. You brought up the CMOs. Is this going to affect anything with the CMOs?
They're going to get more clients. Given our contract with them now, they have agreed to absorb the anticipated amount of increased clients for the next 2 years. I do think there's going to be a budget increase request after that, but at least for now, there's no additional cost in that area.
Okay, so when we get these quarterly adjustments for the CMOs, how will that be evaluated then? Because we get the adjustments for the clientele that they get. It either goes up or down or stays the same. So you're just kind of
You get-
ignoring those numbers at
You
that
get
point?
quarterly adjustments on how many juveniles they're serving or what they're charging.
How many they're serving?
Right.
No. It's encounter data.
Oh, okay. And I'm just saying that the encounter data is likely to increase in
Yes.
encounters,
Yes.
but for the next 2 years, we're not going to have an increase in cost with them.
There's the boss.
Will be correct.
Okay.
Good morning, Shanetta Coleman, Division Director for Juvenile Justice, Wayne County. The quarterly adjustments that you're speaking of course, are based on the actual daily caseload averages. So the CMO's adjustments will go up or down depending on how many kids are serving within a particular quarter. We do not anticipate that there's going to be any additional costs in at least year one for that. And we say that because over the years, the average daily caseload has gone down. We contribute that to the first contact programs, a number of our diversion programs and youth assistance programs, because we're diverting more youth and putting them in early, what we call front-end programs. And so we have been seeing fewer participants in the probation level 1 and 2. So we do have a little bit of a threshold there in terms of being able to absorb more cases. And so currently, we do not anticipate there being a financial burden to the CMOs. Will they have to serve more youth? Yes. And we've already seen, as we've been working through this process, an uptick in the number of youth that they've been serving within the fiscal year. So we start seeing that very early on. So they're going to have to, scale up in terms of staffing, but the level of service and care to the youth will continue to be optimal.
Okay, so that's really the only thing with
Yes.
that, the CMOs. Okay,
Okay.
thank you.
To that point, Commissioner Killeen?
That point. Thank you, Ms. Coleman. What she is describing there is really how successful and forward-looking our current program is, that we are diverting people out of the system. And indeed, counties do come from around the country to look at what we're doing currently. So to be able to improve that, and at least for now, for no additional dollars, because we have more capacity in the system,
Yeah.
because we are keeping kids out of it at the front end
Right.
to a large degree. So I just want to underscore that. We're doing an excellent job now and an innovative job, and this will just further help that along.
Speaking of the diversion, I would add that by doing the early assessment at the time that the petition is filed, it is anticipated that there will be information gathered from that assessment that will provide the defense attorney the opportunity to go to the prosecutor and obtain a second look at a number of other cases. So we anticipate that by implementing this new system, the number of diversions will also go up as well. So once again, to the extent that we can keep juveniles out of the system and that they can get the help and the services that they need, that's a win for everybody.
Great, thank you. Commissioner Baker McCormick?
Thank you. So the diversion program that you have in place, or I don't know if it's through the new organization being formed, or is it through the CMOs?
Well, actually, it's neither, as I understand. The prosecutor's office has a diversion program.
I see, okay.
And they divert some cases before any petition is ever filed. But there are going to be some cases where petitions will be filed by the prosecutor's office. But when the assessment is done by the clinic, there will be information gleaned from that assessment that will be able to persuade the prosecutor's office, hey, you need to take a second look. This is somebody else you ought to divert. So it's sort of a second bite at the apple.
So the prosecutor is the only one that can petition. Say, for instance, a school counselor or a parent has an issue with a juvenile, and to prevent that issue from escalating, is there some prevention? That's what I'm asking.
Ms. Coleman's coming to
Preventative.
the mic again.
Okay,
Ms. Coleman?
Yes, what Commissioner McCormick is making reference to is the First Contact Program. So the First Contact Program is a program for youth who are high risk of being adjudicated if there is no intervention before they even make it to a prosecutorial contact. So to your question, as it relates to the schools, churches, community leaders, and police, absolutely, they can make a recommendation for preventive services. Those young people who we currently provide services for in our First Contact Program have no official police contact or ticket, or have had no engagement with the prosecutor's office at all. So if the schools see that little Johnny is running around with the wrong crowd, maybe experimenting with some substances, and want to make a recommendation for supportive services, absolutely, that is still available.
And so in the new setup, that will be there.
That will not change. None of the services that we are currently providing, we anticipate any impact to those services. We might have an uptick, hopefully, in our diversion cases, as Judge Kenny referenced, that this pre-risk assessment that's going to happen at the point that there's contact or petition filed, we hope will be able to be beneficial with diverting more cases. But the diversion programs already exist.
Okay, and is there a number phone number that a parent can call directly for the diversion program?
Diversion, not necessarily.
Okay.
And I say that because a parent would not, that's not the entree to a diversion program. The entree to the diversion program comes from the prosecutor's office.
So that
However,
would be the first contact.
the first contact,
That's right,
absolutely.
okay.
So I'd be more than happy to share all of those contact numbers. We have first contact programs that are physically located by geographic area so that they are easily accessible to the young people.
Great, thank you.
You're welcome.
Commissioner Colleen?
Yeah, and before Ms. Coleman gets, can you share numbers with us in terms of the kids that are referred to a first contact program? What percentage of those actually do wind up having some adjudication later on? Just for context for how that program is keeping kids from offending.
So I don't have committed to memory.
Yeah.
What that number is. What I do have committed to memory is that we're just finishing up our draft for our 2019 for first contacts, and we have about an 87% success rate.
And that's just what I wanted the commissioners to hear, that the program that we have right now, the success that program has done for at-risk youth that are referred by counselors, teachers, or whatever, that this kid might be heading down the wrong, the program is keeping them out of the judicial system. That's it. Thank you.
Okay. Thank you. Commissioner Scott?
Thank you, Madam Chair. The program that Judge Braxton had, is that part of the diversion program?
Judge Braxton, we've received a number of, I don't know specifically what programs she has, but I do know that she will refer a number of youth to the youth assistance programs.
Right.
Yes.
Okay, yeah, and then there's a graduation, because at the last graduation, I think it was, yeah.
Commissioner, that-
Commissioner Ray and I was there, and then I know that Commissioner Ware is usually there, but she did give resolutions to all the kids. And I'm seeing more and more. I try and go to those as much as I can. And then Black Family Development really do some things for the whole family. I attend a number of their Saturday luncheons that they have, you know, and it is just fantastic what they do with those young people and their families.
Yes, ma'am. We have Ms. Brown here, could speak specifically to what Judge Braxton does.
Okay.
So, thank you, Commissioner Scott. What Judge Braxton does is actually, she's over our STAND program, which is our youth drug court. So it's a specialty court in our juvenile justice system, as well as the specialty court for juvenile mental health court. And typically, the youth goes through a year where they're tested for drug usage, making sure they are attached to services, and actually completing those things. Maybe it's tutoring, maybe it's pro-social and things like that. And then at the end of the year, when they do the graduation, they do send the invites out and ask the commissioners to attend. And believe me, your being there really does make a difference to these youths and these families. On average, there's like 60 kids active each year in the program. So we get federal funding for that and also some state funding and local funding.
Okay, I'm really impressed with both of those.
I will let her know. Thank you.
Name, I'm sorry, name it for the record, please. Name and title for the
Sanel
record.
Brown, Executive Court Administrator.
Thank you so much.
Thank you, Madam Chair.
Thank you, Commissioner Ware, Vice Chair Pro Tem Ware.
The participants, my question is for you, Doctor. The participants that, the agencies that participate in the program, they receive child care funds?
Yes.
How many agencies?
Oh, I think we're down to about 11.
11?
Yeah, but
Throughout Wayne County?
Yes, we do have an RFP that we're going to be releasing because we do recognize that our number of first contact providers as well as the number of youth assistance providers has gone down. So we literally just released an RFP for the youth assistance program, and we have one underway for the first contact program. They've done a phenomenal job with saturating Wayne County in terms of providing services to young people in a multitude of zip codes. So what I will make sure that you all have is a list of those providers and what zip code areas that they actually serve, and they're multiple.
So what I would like to have is I would like to know how many participants they have served. And I would like to know, because I do meet with some of the providers, that there's a great need for the service. And so, for example, they might have a contract of, I'm just going to say $20,000, 15. I know it's more. And then they they have provided those services, but there's still a need. Do we go back and amend the contract?
For the youth
That was
assistance,
my question.
for the youth assistance program, we have a set amount of money, because as you know, a lot of the dollars that fund that program are the millage dollars. So we're pretty structured as it relates to that. For the First Contact program, yes, we can go back and amend those contracts to increase the funding because it's partially child care fund, and we can make adjustments for that and ask for additional money. And the other 50% is borne on the part of the provider who raises those dollars. So if the need is there and they make the request, we can definitely accommodate that.
Okay. Now, may I have a phone number? I'm not gonna keep emailing people back and forth. Sometimes I have a lot of questions, and I wanna make sure I have the correct understanding, and I need a phone number that someone's gonna answer, please.
I will give you my phone number. You want a phone number to this?
Pete, maybe it's a miscommunication. I want a phone number where someone's gonna answer the phone or listen to their voicemail and call me back. That's my request.
Yes, 313-833-4785.
Thank you.
You're welcome.
Thank you. So what what you're asking for, Mr. Kaufman, is for a budget adjustment, correct? Correct. And that needs to go through the system. I don't believe it's gone through as of yet. Did you have a question, Ray? It hasn't gone through as of yet, correct?
I don't know.
Okay, the staff is saying
Send
no.
it to you.
Okay, so this was a preliminary discussion because I think everybody needed to hear what was going on and how this affects do change to how we're operating. It'll go through the system and then it'll go through our normal process. Now, the only thing is that it may come on April 2nd. And at that time, it'll be retroactive, Mr. Commissioner Basham. but we'll talk further as the proper way to go through the system and to get on our agenda. But I wanted all the commissioners to hear this because it was very important to know the change that we're doing. And again, this is a discussion, so there's nothing to vote on today. But if you do have any further questions, Judge Kinney and Judge Hoffman will certainly be available for you to discuss with them.
Anytime.
Just a
Commissioner Baker McCormick.
clarification. So the amount of the budget adjustment would be the 417, or is that the amount?
That's the only amount that's, in effect, Wayne County dollars.
Okay. Yeah. Thank you.
That's 5 minutes.
Thank you.
Okay, thank you so much. Thank you all. I appreciate you. We're going to move this agenda slightly. We have someone here for the census. She has another appointment, so we're going to allow her 5 minutes to come speak to us really briefly about the census and what we're doing, 5 to 10 minutes to have that discussion. Your appointment is at what time?
It's at 11:30.
Oh, 11:30. So it's 11:20. So do you want to discuss now or do you want to reschedule? Because 11:30 is in 10 minutes.
I can share where we are.
Come, yes, let's come and give us a brief so you won't miss your next appointment. Thank you for waiting with us.
I apologize, but my name is Bridget Weich McGee. I'm the Partnership Coordinator for the state of Michigan. And actually today, March the 12th, we have opened up the website for people to respond to the census. So as you know, there's 3 ways to respond: over the internet, by calling in on the 800 number, as well as filling out the form for those that will receive one. The invites have gone out to most Americans throughout the country to invite them to go onto the website. There is a code that will be on the invite, but you don't necessarily need that to go on to the website to answer the form. Actually, I just pulled it up and you can just go on, it's my2020census.gov.
My2020census.gov.
And that's the link for you to answer the form. We are also in the process of hiring for the non-response follow-up piece, which starts in April. We're reaching out to most of the applicants at this point. We are also in the process of doing our group quarter enumeration that deals with the universities and nursing home facilities, the homeless, and things of that sort. So we're gearing up for that as well. We're also pushing an initiative out calling our mobile questionnaire assistance centers. And so we're reaching out to our partners to identify different locations where we can come out and support those who may have challenges answering the form or have any questions with the form. And so we will deploy our staff out to those events where they would have a laptop to allow individuals to respond online or assist them in responding online or assist them in calling an 800 number.
Is there, as you mentioned, assistance, a team dedicated to going to nursing homes and senior citizen buildings? Because those would be the persons I would think who would be difficult to answer online or in the questionnaire?
Yes. These questionnaire census centers, we are looking at them what we call in our low or high low response score areas where we're looking at the previous 2010 data that shows where the response rates were low or the response rates were high in reference to the number of people that did not respond. So we are identifying those type of tracks that we will focus on primarily first to ensure that we're supporting those that had not responded before.
Okay. And you said today is the first day that they can go online. The actual census day is April 1st.
Correct.
And then those who don't respond, by what date then will people start going out knocking on doors?
Well, non-response follow-up will start in mid-April.
Mid-April.
Okay, but people can respond all the way through July. July 31st is the final date that you can respond.
Okay. Very good. Do you have materials for us?
I left some materials because we are still recruiting.
Okay.
I left some materials on the table there.
Okay. Mr. Baxter, did you want to add anything on the Wayne County efforts? Okay.
Just briefly.
Name and title for the record, please.
Daniel Baxter, Director of External Affairs, Wayne County. Just briefly, first and foremost, thank you for this opportunity. Briefly, we've been going around throughout the entire county to make sure that we have complete count committees for each of the 42 jurisdictions, excluding the city of Detroit. Those committees are in place and they're working vigorously to make sure that every person within their community have been afforded with the opportunity to be exposed to the importance of the census and ultimately complete their forms. In addition to that, we have identified 10 key communities that had low response rates from 2010, and we're working heartily with them to make sure that their numbers come up. Communities like Hamtramck, Highland Park, Redford, Inkster, Romulus, and the like. A bit of good news is the state of Michigan has afforded Wayne County with a $250,000 grant to support efforts to make sure that those communities that I just mentioned have greater access and opportunities to fill out their forms and be counted for this 2020 census.
Okay, will those funds go for education and literature or for employment or?
Education, literature, outreach, and any other administrative responsibilities. The range is broad in terms of how we can use those dollars, just as long as it's focused to ensure that every person is counted.
Okay, thank you.
You're
Commissioner
welcome.
Marecki.
Question. You said that they can respond till July 31st. So in mid-April, when you go to non-responders, how do you know they're going to be non-responders if they have till July to respond?
We are able to track the addresses that have responded, and actually there is a link in a mapper. I can't specifically give you that specific link, but it's on the Census 2020 website that will allow you to see real-time response rates. And we will be tracking how individuals are e-responding on the website, either by internet, calling into the 800 number, or submitting their form.
Okay, so how do you determine who to respond?
It's
Are there
based
place-
on address. So once they respond, that address, we have a master address file, and once an individual respond based on that address, we will know whether whether that response has been accepted for that household.
Okay, so maybe I'm confused. So in mid-April, you're just going to make sure the people that responded, it's going through that they responded? What's happening in mid-April with the
Mid-April
non-responders?
is we will be going out and knocking on doors for those who have not responded.
Okay, but if they have till July 31st to
Mm-hmm.
respond, then how, you're just
Encouraging them.
if they do it in 2 weeks, you're just going to start
From
going
that
out,
point, once we deploy the team in April and they have not responded, those are the ones that we will be reaching out to. Now, if they will respond, we will be able to update that list at that time so that we don't have to go back, we don't have to duplicate our efforts.
Okay.
So it's constant, that address file will be constantly updated as people are responding through July.
Okay, so you're just going to keep on people to respond? before
Yes.
July. All right.
Because April 1st is the actual census day. Everyone should, wherever they're sleeping on April 1st, they should respond as such. And then they'll have time up until that date. But after April 1st, 2nd, 3rd, 5th, they'll just start reminding
Okay.
you to come out and to make sure you fill out the form.
So the goal is really to do it April 1st?
Right,
Okay,
correct.
okay.
But
I
you
guess I
have
didn't
until
realize that.
July.
Got
Yep.
it.
Commissioner Baker McCormick?
Thank you. And the phone number that you can call, is that on? I don't know.
No,
if that-
it's not
not
on
on here,
there.
right?
I can forward that information to you, the exact phone number that
Okay.
they can call into.
And when will the forms be mailed?
They are
On-
being mailed out as we speak.
Okay.
So they
So we
all
should
don't.
all get them by April 1st.
Oh, yes.
Everybody
You will
should
have
have
an
them in
invite to
hand.
respond before April 1st, because
Okay.
they're being mailed out as we speak.
Okay.
Yes.
Yes, and all I need is the number, and if you have anything that we can send out with the actual phone number,
I will email
Yeah.
the
that would be great.
board. I think I pretty much have everyone's email. I will forward that information.
Well, what I'm asking is if you had something like this, a one-pager
Mm-hmm.
PDF with the phone number on it, that we can then communicate
Sure.
to folks, that would be great.
Okay, I think we may have a flyer or something or a fact sheet.
All right, thank you.
Yes.
Vice Chair Pro Tem Ware?
Thank you. I'm on the Detroit committee. I'm volunteering with Detroit. But I don't think that some of my colleagues are aware that the census have somewhat changed and rearranged the census this year. For example, in the area I represent, a lot of our seniors will not be receiving a paper form of the census. They want them to go to the computer and complete their form. So some of the service coordinators and other staff in the building and the volunteer team, everybody's trying to really work with those buildings so the residents will know where to go. In the past, and you can correct me if I'm wrong, in the past, we generally receive a paper form, everyone, but there are some zip codes that will not be receiving a paper form. And in the Detroit area, to my Detroit colleagues, you all don't have that problem. It's primarily in my district, because you know I represent downtown and midtown, and thank you.
What I can speak to is that this is, in 2010, it was all paper. This is the first time that we've opened up the internet and the 800 number. And so for the seniors, that's one of the things that we are really pushing, that even if they are having challenges going onto the internet, they can call the 800 number that I will supply. for them to call, and they can answer answer their questionnaire over the phone with assistance.
So in the buildings that I represent, and I have 43 in my area, senior
ma'am.
designated buildings, but not all 43 are receiving that, not all 43 have to complete by computer. They have received information over and over and over to try to educate them. And we encourage them to go to the service coordinators in the building because they do trust those individuals.
Yes, ma'am. And I'm sure as you're working with the Complete Count Committee with the City of Detroit, they have also identified several mobile questionnaire assistance centers. And we have partnered with some of those activities that they have. And then for those that may not have an event, we will try to have an event to support those seniors in those buildings as well.
Yep. Thank you.
Thank you.
Thank you, and we do have the literature that you have there. You can email any additional information, will be very helpful. Mr. Baxter, continue to keep us informed as the countywide efforts outside the City of Detroit. And if I'm not mistaken, the City of Detroit is having a function this Saturday. If it may cancel, yeah.
They canceled.
They did cancel
Yes,
it,
ma'am.
yeah, okay. I know with the coronavirus and whatnot, was wondering if that was going to be canceled. So, but everyone look out for the census information. Make sure you tell your constituents. Commissioner Scott?
Thank you. Well, if all the seniors are not getting them, or what are you sending out, though, by the 1st? What's being mailed out?
So there's a letter of invitation that everyone will receive. There's certain portions of the City of Detroit where they will receive an actual form in certain areas, but everyone will receive a letter of invitation inviting them to go on to the website to answer the census form.
Oh, that's what that's for, just for the website, what you're getting in the mail.
Yes, but some parts of the City of Detroit will receive an actual questionnaire because of the low internet service, where they may not have internet to go online.
Okay. And Mr. Baxter, you're working with block clubs and that in our cities that you mentioned?
Yes, so the Complete Count Committees are represented of elected officials, clergy, as well as community leaders in block clubs. Yes, ma'am.
Okay, all right, because when I was in Washington, I attended a meeting regarding the census, and I asked them why couldn't precinct delegates be paid, and they said it was because it was political.
Well,
Because of-
precinct delegates have every opportunity to apply to work as, what is the term, census takers?
Yes,
Yeah,
enumerator.
No, they
enumerators.
said they couldn't because,
They're an elected official.
because they're an elected official.
They couldn't get paid.
Because my thing to them was, these are people that know everybody in their community. And I just thought that that would be certainly the precinct delegate who knows that his or her community. But I was told because it was political, Democrat, Republican.
Well, because they're an elected official.
Right.
Yes. But that doesn't mean that we can't partner with them. I mean, that's the whole important piece, is for us to partner with those delegates and.
But they just can't be
Get
paid.
paid, correct.
Okay,
Yeah.
thank you.
No elected official can be paid for the census. So, yeah, you have to volunteer. So,
Precinct delegates don't make any money.
Right.
So that's what I don't understand. That's my problem.
they should not check elected official then.
Okay.
Any additional questions for our census team? All right, thank you so much for coming. I appreciate you.
Thank
This
you
is
all for
very
allowing-
important. I know the county is doing all that they can do on the administration side. I know each commissioner is doing all that they can do to get the word out as well. So we'll continue to be vigilant.
Thank you.
Thank you.
Thank you so much for the
The
opportunity.
mayor's office is working hard, yes. Thank you so much. I appreciate you. All right, 2 more items. We'll go to the mental health. Madam Clerk?
We're moving to item D4, a presentation by Willie Brooks and Bernard Parker from the Detroit Wayne Integrated Health Network.
Hello, Mr. Brooks.
Good afternoon.
How are you?
Good. I would like to offer you a very affectionate arm bump.
Absolutely back at you.
Thank you for the invitation. I know time is of the essence, so I will try to be to the point. As you know, we serve roughly 75,000 individuals, which represent 25% of the Medicaid population in Michigan. We're the fourth largest mental health agency in the country, with revenues over $830 million, and still the need is tremendous. We serve children and adults with mental illness, autism, individuals with intellectual disabilities. As you know, we work with substance use also. We work with the court system, schools, hospitals, and over 500 major providers in Wayne County. So we cover a lot of territory. I just want to go over a few of the things that are going on. I heard a lot of talk as it relates to jail diversion. I'm also a member of the Governor's Jail Diversion Committee. One of the things that we're doing there to really assist us is to help guide some of the financial restrictions that we have as it relates to working with different entities. Medicaid dollars cannot be used in a lot of the preventive things that we do, such as the jail system, working with the schools. Therefore, we can invest a lot of our dollars in the system. However, the savings occurs in a different funding system, which makes it difficult. So those are some of the things that we're trying to work out, some of those financial restraints at a state level that will allow us to do certain things that save a lot of money. It was mentioned that 83% of the individuals in the jail have some type of mental illness or substance use diagnosis. We can track that information now. We also know the importance of dealing with teens in the school system and detecting early trauma before it reaches a capacity in which those individuals are deeply involved with our system also. So those are some of the preventive things that we are doing, working with the jail system, working with the schools to try and get a handle on mental illness. Other things I just want to mention, it was brought up earlier regarding the SIP program, which is a specially integrated plan. This is a plan that the governor is proposing through Department of Department of MDHHS, in which they're looking at an integrated system with a managed care organization, health plans, community mental health, and providers along with hospitals. They're hoping that this program can go up in 2 years. It's something that we're working on diligently with the department. Hopefully we can work out some of the issues with this program. We are both a prepaid inpatient hospital plan and a community mental health plan, which actually means we have the ability to hold Medicaid dollars through our PHP. The PHP will be eliminated. That is the plan of the state, and those dollars will fund through a managed care organization in which we will act as a party with them, managing a network and actually serving people. So this will be a major change that is occurring. I've been in Lansing every week working on these proposals, looking at some of the different developments, hoping that we can make a few changes so that the people that we serve can still benefit from this process. You know, some of my concerns is I want to make sure that the managed care organization is here to actually service people and that profits are not taken out of the system with an expectation of a lower level of service. I also want to make sure that the public entity still has a major role in this process. This allows people that we serve to have a voice, and it also allows to make sure that the focus is on the people that we serve. So there are a lot of major changes occurring as relates at the state level that is going on. There are some funding issues, too, that we're dealing with. As I mentioned, we serve roughly over 75,000 individuals. And even though we serve a high number of individuals, we still have a system that really underserves the population. You know, statistics show that 40-60% of the individuals who actually have a mental illness are not receiving treatment. We've seen that in our growth, such as our autism benefit. When we first started the autism program just 5 years ago, we spent roughly $5 million. This past year, we're approaching $70 million in just a 5-year period. And it's mainly because of the fact that more people are aware of this service. And as, of course, more people are aware, the increases occur. So we're looking at all those various increases. We're working with the state to handle that. We have a few budget issues, again, that we're dealing with the state. They made a few calculations that were not advantageous that they're trying to correct. They did recognize that the system is roughly about $120 million underfunded from what their earlier projections are. So we're hoping that can be corrected. And then I just want to talk a little bit about some of the other things that are going on. We mentioned coronavirus. Some of the people that we serve, we're particularly concerned with our population. We want to make sure that they receive service. We want to make sure that they have access and also that they notify individuals. So we're working with our provider community to make sure that we can address that issue, along with our staff, as every organization is doing. So that's kind of a highlight of what we do. You've been given our annual update, so I will not go over that, the annual report word for word. It just tells some of the things that we're doing as relates to crisis. It was mentioned that we're trying to get our crisis center up for next year, and we're doing some of those expansions, and just some of the many things that we do in working with the police force as relates to training them, passing out Narcan kits. So we're heavily involved. As a matter of fact, everyone who came up to speak today, we basically have some type of connection with them in the community. So we really play a large role in the community as detailed in our annual report. So with that being said, I would like to open up the door for any questions you might have.
Thank you so much for coming and providing us with this information. I have a couple of questions here. With the managed care organization going for the SIP program, is that going to be determined by the state who the managed care organization is going to be, or which each county and community organization decide upon themselves?
So I was actually talking to Robert Gordon on that specific question, I believe, yesterday. And my suggestion would be for the department to play a key role in establishing that partnership. Mm-hmm. And the reason why I say that is there's a lot of conflict of interest that are out there. When you're dealing with 3 or 4 organizations that have to work together, each organization is mainly going to be looking at their survival. Mm-hmm. So you need someone to give direction as to how those unique entities will work together. I'm recommending that the department provides more stability and direction on how that partnership should take place versus allowing just a free-for-all when you have several entities trying to work this thing out. As you know, we had a 298 pilot in which just the health plans and mental health were trying to work out a partnership. And after 2 years, they came to the conclusion that did not work. So I don't want the same thing to happen. I'm hoping that the department takes a lead on establishing this new partnership.
Okay. And then with the census, are you all working with the providers to make sure that all of the individuals in your care are being counted?
Yes, each census, we play a major role in making sure that the people that we serve are represented. As you know, each person definitely matters. And it makes a huge difference as it relates to funding and assistance throughout the state. And the people that we serve are volatile, so we want to make sure that they're included, and we do participate each time that occurs.
Okay. Thank you. Okay, we have a list. Commissioner Marecki.
Thank you. Now that you're here, I just wanted to ask you a question. I spent the afternoon this week with a group that is, just bought a big house in Northville. It's actually Novi, but it's in the city of Northville. They've got an autism program that's going to be for autistic adults.
Yes.
Various programs inside of this community. They would like to connect with your organization. Are you aware of what I'm?
No, I'm
Okay,
not.
so how would they do that? Because I understand like your vendor system has changed. How would they approach you guys they have a community-based program where they take the autistic adults and they work with businesses.
Yes.
They might come into the business and water their plants or do various things, and they'd like to connect with you. They asked me to find out about this. So how would they do this?
We actually have a credentialing process in which providers can actually call
Okay.
and actually be credentialed,
And it can be what?
credentialed and receive license to
And
work
I
with
think they're in the
us.
process of doing that. They had done this years ago, but after that, after the credential part,
Once they're credentialed, then all they need is just the people that we serve to be housed in that unit. Once they're credentialed to us, then we can start an actual contract with them.
okay.
So if they have the house and then they have people who are being served who are in there, then that would actually start the program.
Okay, so just going through this credential would
That is
start the
correct.
process.
And that is one of our fastest growing areas. It's one of the areas also that we actually wrote a letter to the state, basically telling us how we were underfunded. The previous year, we spent roughly $62 million, and we only received $45 million in actual funding from the state. This year, we're on pace to exceed $70 million. At one point, the state was actually reconciling and cost selling with us, but they stopped that process a couple of years ago. So the door was opened up to allow more individuals to participate. They increased the age all the way up to 21, and they reduced some of the restrictions. They just didn't add the money. So we're in the process of actually petitioning to get more funding for that because it is growing, just as you mentioned. There's several providers who are also trying to get in that program.
And just one last question. So would this all be done through this credentialing? Does somebody go out and look at the program before any kind of contract or whatever?
Yes, they actually apply. We have people in the field in the credentialing process who would actually work with them
Okay.
to make sure that those Medicaid guidelines are being met.
Okay, so they would actually see what this group is doing?
Yes.
Okay, all right, thank you.
Thank you. Commissioner Scott.
Thank you, Madam Chair. You mentioned a crisis center. Do you have a location, or are you in the process of looking for a location?
We do have a location now that we're working with the board on that we're trying to secure.
Where's that location?
We have a location that's actually on 7 Mile and 7 Mile area. We're still in the process of negotiating, so we can't really reveal a lot because we're actually bargaining and negotiating, and there's other individuals who are trying to bargain with us.
Is it like a hospital or a clinic or something?
No,
No.
it is something that we're looking at converting.
The
So
building?
That is correct.
Okay. All right, thank you.
All right.
Thank you. Commissioner Killeen.
Yeah, thank you, Madam Chair. At the beginning of the chair referenced managed care organizations. I just want to call attention to and she was referencing this one-page white sheet that was provided in the folder today, and that will start giving you an idea of what we're going through with this 298 and this SIPS thing and where that is in Lansing and perhaps what some of the consequences are. So I would encourage not only the report that's, the full report that's in there from the executive director, but also take a look at this behavioral health redesign change in Michigan, because you may want to have some contact with your state legislators with regards to that. So it's very important one page here. It's going to set the tone for how mental health dollars are distributed and who gets those mental health dollars to provide the services that's been alluded to here. I'm committed that it has to be done through a public system and not through a for-profit system. But I just encourage everybody to read that sheet and have some familiarity because it's big changes coming.
Thank you, and I'll say that Commissioner Killeen will continue to keep us abreast of the changes because he is our resident professional expert on the mental health and what's going on. So he keeps us abreast on that through his Health and Human Services Committee. Any changes that we need to be aware of, any action that we need to take, Commissioner Killeen, please let us know so we can move forward to make sure.
Keep everybody updated as
Yeah.
we go and not just dropping on them going, oh, we have to do this or something,
Absolutely, because we
to
want to
have the
make sure
background.
that we're serving the people here the best of our ability. So any additional questions for Mr. Brooks? Thank you, sir. We
Thank you.
appreciate your time and what you're doing with the organization. And again, please keep us informed if there's any action that we need to take with Lansing, the governor, the legislature, to make sure that we're serving the population the best as possible.
I appreciate that. Thank
Thank you. Thank you so much. Madam Clerk, next item.
We are moving to item number 3 from Marcella Cora, Wayne County Legislative Auditor General, forwarding the agreed-upon procedures report on the Wayne County Commission.
All right, this is our audit of the commission that was done January 17th through December 2018. Marcy, you're on.
Marcy Cora, Auditor General, and I'll have Jay introduce himself.
Jay Wild, Principal with Allen Young and Associates.
Okay, thank you.
What you have before you today, Chapter 65-8 of the Wayne County Code of Ordinances requires a commission to have an audit every 2 years. So in order to perform that, our audit goes out and procures an outside external auditor that comes in and does the audit of the commission. We also ensure that our office is included in that audit. For the scope period of January 1st, 2017 through December 31st, 2018, Allen C. Young and Associates was the firm selected to perform the audit. The objectives of the engagement was, 1, assess the effectiveness of the commission's internal controls to ensure compliance with commission's rules of procedures, Wayne County ordinances and resolutions, state of Michigan and federal laws. 2, examination of commission's payroll and human resource management. 3, assess compliance with said rules and procedures and other applicable county, state, federal laws, rules and regulations. And then 4, follow up any prior year recommendations. So I'll have Mr. Wild go through the results of the engagement. Tim and Mark are available to answer any questions anyone may have.
Thank you, Marcy. Good, I guess it's still morning, so good morning, everyone.
Good morning.
Again, my name is Jay Wild, and I'll just kind of lead you through kind of the results of our procedures. Start out very easy. The first item, assessing the effectiveness of the commission's internal controls to ensure compliance with rules and procedures. We had no exceptions in that area. So everything we tested, absolutely no problems.
Good.
The next item, looking at payroll and human resource management. We did have a few small items that we noted that we did include in the report. First of all, we looking at the payroll for the legislative aides. We had one case with one aide where the commissioner's certification could not be provided for the 4 pay periods we tested. So in the absence of the commissioner's certification, obviously we're unable to verify that the commissioner had signed off on and approved what was paid to that aide. Secondly, for 7 of the legislative aides we tested, and this was for a total of 20 pay periods, the original time record form that the aide maintained was not available for our procedures. So we were able to see that the commissioner had signed off and approved the time, but the original time record was missing. That could have been because of the commissioner having no longer being in that position, having left and taken those records with him or her, or just those records were no longer available because of a lapse of time. Then the third item, we had one instance where an aide was overpaid by 50 cents per hour over 2 pay periods. This was corrected after that point in time, and the total overpayment for the pay periods was $80. So again, in the big picture, a very, very small item, but with the nature of this report, we do include any exceptions that we find within the body of the report. Next, in looking at compliance with said rules and procedures, we did have one small exception that we noted, and that's relating to the Committee of the Ways and Means. Looking at the meetings, there were 5 meetings held where there was a commissioner that was absent and there was no written notification that was provided or available for that absence. So kind of a record-keeping sort of requirement that is in place. Then the final area where we had a few exceptions, and again, this is looking at compliance with said rules and procedures. And this, again, is kind of a just sort of a record-keeping sort of item, and these are relating to the budgets and the monthly expense reports. In looking at the monthly expense reports, we were unable to verify the date of distribution on these reports. There is a specific requirement, a certain point in time when these are to be distributed. The records and documents we were provided just did not include any date, so we could not verify if the date was in compliance with the regulations. Next item is regarding the commissioner's approved budgets and the date of submission of these budgets. Although we were informed that the annual budgets were given to the commission's chair to each commissioner by October 1st, we were unable to verify what that actual timing is. So again, no sort of memorandum or document that included that specific date to verify that happened. The one commissioner where we were able to verify the date actually was beyond the date of compliance. So that one case was out of compliance, the other 14 we could not identify. Then the final exception that we noted throughout our procedures relating to the budget given to the individual commissioners. We found that 3 of the 4 commissioners we tested for 2017, and all 4 of the commissioners tested in 2018, their annual expenses exceeded the budget. Now, we were informed that verbal approval was given for these overages. Thing with verbal approval, certainly we can't test that. We can include that response here in the report. And also, we want to make very clear that in total, the total expenditures for all commissioners was below the budget. So it seems there were just some shuffling of the individual expenditures that did take place. In total, there was no overage. Otherwise, everything else that we tested, very clean, efficient, everything went very smoothly. We were given complete cooperation throughout the process. And, again, just very, very glad that we were given the honor to work on this project and happy to answer any questions that may be in place.
And I just wanted to add on this agreed upon procedures report, the objectives that were used in this engagement are also the same objectives that were used 2 years ago. However, what they do when they test compliance, they may change the rules of procedures that they're looking at. They're not always looking at the same rules, so that's the only difference.
Okay. Tim, did you want to add?
Yeah, one quick thing. I just wanted to thank Gina Molden and Cynthia Douglas of our staff who really worked hard pulling all the information together.
Yes, there are a lot of documents that we asked for, and we certainly appreciate that help.
Thank you. Thank you. Questions from commissioners? Commissioner Marecki.
Thank you. So am I assuming that if one budget went over, it was taken from another budget? And if that is true, is the commissioner who the money's taken from, are they made aware of that, if that's true?
Mark may be able to.
Mark.
We have the allocation on a commissioner by commissioner basis, and what we do at the end of every period is look at each individual commissioner and the total, and basically we align the bottom line. So collectively, as a group of 15, we are not over budget, but there may be some instances where a commissioner may be over budget in respect to their specific allocation.
So,
And is there awareness? Yes.
their awareness that they're over budget, but are you actually, for the bottom line, taking it out of another commissioner that's not?
We just look at it in totality. It's not like one was, we're not like,
Okay,
I mean, I don't know.
so you don't have to tell a commissioner that they're
where
transferring
I'm
their
taking
money
it
to
from.
somebody
No,
else's?
we just look at it in totality.
Okay, thank
As
you.
one line item. I will say, though, looking at the things that were listed at the exceptions, and I will note again, this was January 2017 to December 2018, prior to Commissioner Bell becoming the chair, for the record. But I think it's important that we look at these items and that we conduct ourselves accordingly, making sure that we're keeping our staff records tight and everything else such that the next time that we have an audit, that is totally clean. So if I can have the cooperation for all commissioners on that, I think that will do good for the public and that we're following our own rules. Any additional questions, Commissioner Anderson?
What will we be doing to prevent this from happening in the future? Because I think if we're auditing everything in the county, we certainly, and I think you've alluded to, we need to have our own house in order.
For sure. Now, I don't know, Tim, did you send out, we haven't sent out yet, but the exceptions that are made, I'll send a memo to all the commissioners, letting them know globally what those are and just telling everyone to be aware. And if I am made aware of prior to, I will address it accordingly.
Okay, and
A lot of it's bookkeeping with keeping up timesheets and that type of thing. So we'll just have to make sure everyone's individual office that you're staying tight on that. As far as the budget is concerned, we'll, as we have always done, I understand from the previous chairs, we'll just keep a tight rein and make sure that everyone is where they are. And if there are some exceptions that have to be made, there'll be discussion between the individual commissioner and the chairperson.
right, to the comment that Commissioner Marecki made, I think I was hoping to hear, and I think what happens is the excess that's left over in the commission budget was used in these cases before you became chair to supplement those that went over budget. And I would like to see, that information provided to the whole commission. And I don't know if that's what you were saying, we were going to provide to all of the commissioners.
Well, what I'll provide to all the commissioners won't be that detailed. It'll be not on that issue. It'll be what the other findings were. As far as the budget is concerned, I'll talk to Mark and we'll come up with a plan. But Mark had a comment.
If I can make a comment, when I give you the expense report, what I try and do is project, what the spending will be. If at the pace that you're spending remains consistent through the year, where you may be at the end of the year. But where we sometimes get into trouble is, really with extenuating circumstances. If there's a mailing at the end of the year that pushes somebody over budget, where the cost of it may not be completely known at the time that it's ordered. So I'm working closely with Jim Toth to make sure that we have that understanding, and we're trying to work specifically with commissioners to make sure that they understand what the cost may be of mailings if they're close on their budget. So we're monitoring that very closely. And I did want to mention too, although this wasn't part of the scope of Alan Young's review, but on an annual basis, the commission as a whole spends significantly below, and Madam Chair, you may want to mention last year it was over $1 million that we were below budget in totality for the commission's budget in regards to the Wayne County budget as a whole. So that was a very positive note to point out.
Yeah, I think that's good, but it's still, we need to, as collectively, I think, make sure that we're all within our budgets. And I would like to see, even if it doesn't identify individual members, to see the breakdown of how much over we're talking about. Was it $100, a couple of $100? Was it substantial? That's all.
Okay.
I'd like to see that.
Thank you. Commissioner Basham?
Thank you, Madam Chair. As the usual skunk at the picnic, and as Chair of Audit, I have had discussions with the new Chair of the Commission, and as she well pointed out, it was prior to her. And she does have a plan to make the commission accountable the same as other departments in the county. So thank you.
Thank you. Any additional questions? Thank you for your time. Thank you for your efforts. And again, thank our staff, Gina and Cynthia, for the hard work that they put in gathering all the documents that you needed for your audit.
Yes, absolutely.
This is an action item to be moved to full board. So is there a motion to move this to full board?
So move.
Moved and supported. Any additional questions, comments, discussion? Receive and file. Hearing none, all in favor say aye.
Aye.
Any opposed? Nays? No nays? Okay, thank you so much. Moving on to full board. All right, lastly but not leastly is with the COVID-19 going on, I did ask Janelle Allen and Sergio Denaro to come speak briefly about the Wayne County efforts as we move forward with this virus and steps that we're going to take. And for those of you who don't know, I did have a meeting with staff on yesterday, just kind of briefing them on where the county was, what the county was doing, the 2 cases in Michigan that were discovered day before yesterday. So I just wanted to ask them to come and briefly talk about the county's efforts as we move forward. So,
good afternoon. I'm Janelle Allen, Chief Operating Officer with the County Executive's Office.
Good morning. I'm Sergio Denaro, the Emergency Preparedness Director for Wayne County Health Department.
So we would like to begin with a presentation that we have been using for executive level briefings. I know that we did share this with the HHS committee earlier this week, so forgive us, this will be information you've already seen, but we think it is a good overview of the virus itself and the disease, as well as what the county has been doing, and then we'll also keep you up to date as to things we are doing on a constant daily basis. So I'm going to turn it over to Sergio.
Okay. Next slide. So I'm Sergio Denaro. I'm the Director of Emergency Preparedness for the Wayne County Health Department. Next. So I'd like to start with a short video. It's about 4 minutes. This will answer a lot of questions about what is the coronavirus.
we
where
saw
did it
this
come
yesterday,
from.
so we can skip through this.
Oh, you did? Okay.
Yeah, I'm not sure how much you've seen of this already. Of course, you've seen this a lot. You've seen it from the governor, from the CDC's website. The basic prevention measures: wash your hands often, cover your coughs and sneezes with the crook of your elbow, stay home when sick, avoid touching your eyes, nose, and mouth, and of course, wash your hands often. Next slide. Okay, so as of right now, we have 1 confirmed case in Wayne County, no deaths, and we're actively monitoring at this time 11 individuals within Wayne County.
So, I'm sorry, what does actively monitor? That means they've been tested and you're waiting for the results?
When someone is actively monitored, it means that they have been put into a situation where they have the potential to have come in contact with somebody who has the disease, but they are not showing symptoms. So what that means is that they're usually told to self-quarantine, and then the health department will follow up with them on a daily basis, asking them to take their temperature, seeing if they become symptomatic.
And self-quarantine means to remain at home at all times until you are released from quarantine.
Okay, there was a quick question. Vice Chair Pro Tem Ware.
So I need to understand the symptoms because I read and I only see 2 listed, a fever for like 104 and coughing. And I notice a lot of people are coughing, so how do they know they have a cold or allergy or?
So there's no way to self-identify if you have COVID-19. The coronavirus that causes COVID-19 also causes 4 different strains of the common cold, and the initial presentation is very similar to a common cold. So those are the symptoms that you will experience: your typical fever, coughing, and as it progresses, it will turn into some difficulty breathing. So cyanosis.
Are we testing? I'm in a panic now. Are we testing?
So
Where's the test? Please tell me.
Where's the test? And let me, to her point, you can clarify me if I'm right. Is it that you have to exhibit all three of those, a fever and a cough and shortness of breath, or one of the three?
So do you mean in order to get tested?
Well, yeah, I guess to think if you're of high risk or not.
So in order to be tested at this point, you must display symptoms. So it would be all three symptoms and have traveled to an affected area. I know that sounds broad, and
That's too broad, yes.
Yeah.
You're saying that you have to display 3 of the symptoms in order to be tested. Now tell me where the medicine is to be tested. Where are you testing from? The kids.
So,
I'm serious.
what happens, let me give some context. If somebody with
Please.
these symptoms were to go to their doctor or the emergency room, the first thing that they would do would be to test you for the flu, because we're still in flu season and the vast majority of people who have those symptoms have the flu. If that flu test comes back negative, they'll do a full respiratory panel checking for all other diseases that can cause respiratory problems. If that comes back negative and with the physician's approval, then they can test for COVID-19.
And
The way
so-
that they test is they do a nasal swab or an upper respiratory swab using standard equipment that every doctor has in the office, and then they transport that to the state lab. The state lab has the actual tests there, and that's where they do the testing.
So, for the record, I want to say I'm concerned. I know all my colleagues are. But I think that if we have a health department, it's a public health department, and if someone would like to be tested, they should be able to go to the health department and be tested. So I won't ask any more questions. I'm just going to be making an appointment for the test. Thank you.
Okay.
And if to that point, though, the State Department of Health and Human Services, they're the ones who actually then determine who has the ability to test. So even if Wayne County wanted to do that, we would have to get that from the state. They have not authorized us as a testing site.
Yes, I'm going to write the governor, because one thing they did say that was on my side, they said older individuals.
Understand?
Yeah, and I actually will address
Just
that
that too.
Well,
in the next slides.
Thank
Right.
you.
And
One
to
more
that
question
point-
to
yeah.
that point, Commissioner Baker McCormick.
So the 11 actively being monitored because they were in the vicinity of the person. My understanding that the individual that has it works at a school, and the students in that
That case
School.
is under investigation right now, so the only information that we can give is that it's a middle-aged male.
right in Dearborn, but
No.
No,
it
two
was a
different things.
Dearborn
No.
school,
No,
right?
two different things.
no.
was-
I'm referring to a case
Yeah, the
that
case
was
that's confirmed.
reported
Yes.
and confirmed yesterday, last night. Maybe it was last
So
night.
just to correct, that person has not been confirmed as being positive. That person had been in contact with
With
someone
another
who has
person.
been
And
confirmed
that- and
positive.
that's
So that
what-
person has not been confirmed
Okay.
positive.
And that's what I'm referring to, though.
Understood.
That person was in contact with another person that had it, right? And was
Confirmed positive,
confirmed
yes.
positive. So in saying that, the person that was in contact with the other person that worked at the school
Yes.
now is in contact with children. Are they not?
That person is quarantined.
So they're quarantined. Okay, but
Not the students.
not the students. So I guess my issue is that the students that they were in contact with aren't being monitored.
So they were quarantined, the person who had contact with the case that is confirmed, they were quarantined before they started showing symptoms. And Sergio, please jump
Yeah.
in as needed. Health officials have said that there is little to no risk of spreading the disease if you are not exhibiting symptoms. That person self-quarantined before they exhibited symptoms. After they self-quarantined, they started showing symptoms, so now they are being tested. So that would conclude that there is little to no risk that they had spread the virus when they were at school.
And I guess that there's conflicting information because it's being said that you could spread it without knowing that you even have it or having any symptoms.
I can speak to that.
Yes.
So that is it's a fear and it's a concern, but it has not been proven. So there are hearsay reports that it's possible. It has not been scientifically proven that COVID-19 can be transmitted from person to person before there are symptoms. It is possible that it will be confirmed in the future. It's just not confirmed at this point.
Okay. And before we go on, Commissioner Basham did have a question. I'm sorry, Commissioner Basham.
Yes, as a matter of fact, I thought I'd been on the list a long time. This is about containment. And I've been following this pretty close, as most of my colleagues have. The Fed said, and this was the president speaking, the initials are DT, he said, we have test kits. In other words, if you want test kits, we have test kits. But come to find out, the percentage of people they tested was very low because they didn't actually have the test kits to do the test. So the people that they were testing was very low. If they were testing more people, like all of a sudden China started doing, and now Japan, and now Italy, and we're, in my opinion, just from watching different channels of the media and from paying attention to what we get on our computers and stuff, we're way behind the 8 ball. And if we're, going back to my original comment, if we're about containment, it's about test kits, and it's also about the things that you see people have when they get off the airplanes and stuff, to see if they have a fever or not. I don't see anybody in Wayne County, I don't think you have to be a doctor to hold one of them up and see if somebody's got a fever. And all kidding aside, I've seen a number of folks here, and I don't mean that they got the virus or anything, but the coughing in this meeting, because we've been in here for hours. But so you had mentioned the state lab. The state lab, by the time they get something and get the return back to you, it could be a catastrophe because they were testing for the rape kits, and it takes them months and months to get back to Wayne County. So, I mean, what's the lag time from the state lab getting back to people? Again, it's because all this goes back to containment and then trying to stop it. I'm not hearing anything new here. I would really like to hear that, yeah, we got test kits. Yeah, you can do X, Y, and Z. Yeah, we want to contain it. All I'm hearing is, if you're sick, stay home. Wash your hands. Common sense should tell you that. People are panicking, and they want to hear things from leaders saying, we have X number of kits. We have this device. If you got a fever, you don't have to be an MD to have it. We will put one on in your building or whatever. But I don't see us getting out in front of this, and that's what China had to do, and that's what other countries are doing. And we, as a big country, should be doing the same thing, and I don't see it. So how many test kits do we have? Do you know how many Michigan has?
So the issue is not necessarily the number of test kits, but the CDC creates the rules for who can be tested. So physicians have to abide by those rules. So anybody who currently meets the guidelines for being tested can be tested.
And those rules were recently changed, as I believe late last week. Before, I believe, a private physician, they had to actually get authorization from the public health director, I believe. Those rules were changed now that a medical doctor can exercise their independent judgment to say that they believe this patient needs to be tested. Now, I still believe, do they have to still call the public health department?
Yes.
Or they could do it, but if they're in the public health department, I'll tell you, the medical director who works at our public health division, she says she is relying on if a personal physician exercise their judgment, a test is needed, then they're going to say, if they've determined they meet the other criteria, they're going to authorize that test. The test results have been coming back typically within 24 to 48 hours, and it's depending on the time that when it gets to the state. So they have turned them around.
What I'm hearing you say is if if a doctor tests you and it goes to the state lab, they can return it within 2 days. Is that a yes or a no?
Yeah, I'm saying yes, the test results are turned around within 24 to 48 hours.
Okay.
Preliminary test results, yes.
Okay, and the other part of it is about, one of the symptoms is a fever.
Yes.
And when people are getting in the airports and stuff, you have people putting that on their head and checking for fever. Do we have any of those devices?
Those are just thermometers, and
Yes, I
and
know
there
that they
are there's a CDC quarantine and screening section that is active at the airport at Detroit
I'm
Wayne
not talking
Metro.
about just the airport. I'm talking about for other large buildings like in Detroit where people work, and now you're telling people to stay home. The Wayne County, Wayne State University are telling their students now to stay home. Why should we, if we're not getting in front of this, and I'm very serious about this, we need to, it's not by going through these steps, it's about making everybody part of these steps and everybody being involved, and about why would it be so hard for us to allocate a few extra dollars to have Wayne County employees have those thermometers so they can check people and see if they have a fever? If you have a fever, then you should go home. Not just go home because you're panicking, but I don't hear that here.
Understood.
And I don't want to kill the messenger, by the way.
Understood. So to your point, though, about our focus has been on awareness. We believe we have been out in front here in Wayne County, awareness from public awareness as well as from our employee awareness. Because as we said, what we don't show up there is the number of people who have been tested and it came back negative. Because a fever in and of itself really can be indicative of a lot of other things. So I don't think just someone showing they have a fever, that is not going to warrant them getting tested.
But shouldn't that start you down the road? If you have a fever, then you're supposed to look at the next step.
Yes, but they will say, do they have the other symptoms? And as Sergio said, that the thing we say is we refer them to go to your doctor. Call your doctor immediately. You could go to a nurse, and they say call ahead in case that you actually do have something that is contagious. They will then talk to you and screen you over the phone and determine should you go for any testing. As Sergio said, that the first level of testing may just be for influenza. So again, I don't think just having a fever would trigger that, but that's why we're encouraging people, if you do have concern, immediately call your doctor.
Well, that's the same thing as driving a car. If you hit your brake pedal and, it's not stopping the car, then obviously you're going to have a wreck. My thing is, why can't we, as a commission, get one step in front of this, even if it's a small step, and order some thermometers? If you have a fever, it's telling you something.
So
then find out what it is. I'm not saying it's the virus, but at least it's telling you something. Then you should contact your doctor.
Yes.
But you can't just, if you have no way other than going to a doctor to have him check your temperature, why don't we start doing some of these in a couple of places like the Wayne County DPW or in this building here where you got a lot of county employees, order some thermometers.
Are you recommending that we have them so people can just check their own temperature?
Yeah.
Okay.
So I'd like to say to that point, about 4 weeks ago, I did put in an order at the health department for extra thermometers, and we do have them in stock. We haven't actually been asked for any yet because most people do have.
Right.
We can provide them. Most people do have them at home, and so. Although I can't speak for the medical director or the Wayne County health officer, it is our position to not be an obstacle in this process. There is, from the CDC's standpoint, they create the rules that we have to abide by. It's our position to not add rules or add obstacles to that. We try as hard as we can to do our best to get all of the information out to people so that they know exactly what to do, and then try and facilitate that for them. There are certain guidelines and rules that the CDC sets that we don't have control over, but we definitely try to not be an obstacle ourselves.
But as coming from legislative bodies, from local level, from state level to county level, and no folks at the legislative bodies at the federal level, then when you say going by the rules, sometimes the rules have to be changed or improved, which is a continual thing. So I'm just saying that a lot of people are panicking. The stock market is panicked. we're telling people to stay home, we're encouraging the panic, but when you start doing things like thermometers, people start to feel like they're part of the process.
Yeah,
Whether
absolutely.
it's small or not. When you start, and I'm sure some doctors, and I know a few, are getting overwhelmed by people coming because they got a cough or they got a fever. We can alleviate some of that stuff by doing some of these things that are indicators that, oh, I just got a cold. Oh, okay, I'm okay. I don't think we're up to that point yet. That's all I'm saying.
Yeah, and I would like to be able to get a little farther along in this because I do address.
I just, to that point.
Just to that point, and
That
then we'll
second
let,
point,
Mr.
Denaro.
Denaro finish his presentation, but to that point.
I would assume in this conversation, somebody that wants a thermometer, but I would hope we would never indicate that as a legislative body, we start testing people with the thermometers
no,
and
not
think
going
we
there.
can do something like that, because that would not be cool.
You're reading
in
too
my
much
opinion.
into it.
Okay,
Too much Rolaids or something.
okay, thank you.
Go ahead with your presentation, and then we'll have a whole long list of questions.
Okay, so the next few slides here, they set the stage for, from the health department's perspective, what are we dealing with, and then what are we doing about that? So just so you know, as we go through this. So we need to know, we need to understand the threat, and in order to create a response that is adequate to that threat. So on this slide, I've posted some statistics. About 80% of those who have died from COVID-19 are over the age of 60, and about 75% of those who have died had pre-existing health conditions. The reason I put those on there is to show you from the county's perspective what we're working on and what we're going to focus our response efforts on is the senior population, which we had that meeting, that press briefing yesterday. Thank you. So I have a couple slides in here to show you the difference between COVID-19 and some other diseases, some other pandemics. There's a lot of confusion between, is COVID-19 the same as the flu? Is it similar to the flu? So as most of you have seen on the video before, COVID-19 is from a different family of viruses. And so it is not the same as the influenza virus. It does spread at about twice the rate of the flu, and it has an average death rate of 3.4% versus the 1.3% of the flu. That's the reason why we take this so seriously. And of course, as you saw on the slide before, seniors are disproportionately affected by that. Next slide, please. So here's some statistics on the threat, on what would be the impact to Wayne County. So as you can see, 60 to 80 years old has a higher probability of dying if infected by COVID-19. As you can see also, in the 0 to 9-year-old range of everyone who's been infected, there have been 0 fatalities. So hopefully that in and of itself is reassuring to an extent in helping to identify what the threat from COVID-19 actually is. Next slide. Here's a slide that shows some statistics as far as people who have other pre-existing conditions and get COVID-19. Clearly, those rates are much higher than the average, and so that's why people with pre-existing conditions are at a higher risk. So now I'll talk a little bit about the Wayne County Emergency Preparedness Response Measures. So leading up to this, emergency preparedness in general puts together points of dispensing, so we are prepared if we get a vaccine and when we get a vaccine or any type of antiviral drugs. We are prepared if we receive those from the CDC to disperse those to every resident in Wayne County within approximately 3 days. We do a lot of community liaison work to set up those points of dispensing, and we continuously conduct trainings, workshops, and provide educational materials. That's what we do on a daily basis. What we've been working on since COVID-19 has come into the community is an employee awareness campaign. So we've created some educational materials that are based completely on the CDC's guidance. So we don't put any of our own guidance in there, but if you've seen the guidance that the CDC puts out, it's like reading a textbook. It's very hard to digest, and it's not friendly to people like the seniors population. The print is very small. What we did is we created materials that have larger print. It has pictures on there. It's much easier to understand and internalize that information. We're also conducting a public awareness campaign. We are reaching out to places of worship, to schools, we're identifying basically any place where large amounts of people gather or congregate and getting these educational materials out to those people.
And with our seniors in particular, we are utilizing volunteers who work in our Meals on Wheels program, that we are now getting that written information out, delivered to all of our congregate sites, as well as to the seniors who receive their meals via home delivery. And so yesterday, what Sergio was referring to, that we have periodic site manager meetings, and they oversee a congregate site as well as who actually delivers meals in their communities. So we actually had a training for them yesterday talking about a variety of things, but in particular about being prepared, and if you interact with seniors, and to be sensitive to that if they are sick and exhibiting symptoms, just how they would interact and how they would guide the senior themselves about how to seek medical treatment.
All residents of Wayne, are we talking about just Wayne County, including Detroit, or outside of Detroit?
So with our Meals on Wheels program, we just
So that's
operate
outside.
outside of Detroit.
Right.
But we are working closely with the city of Detroit as well. And to the extent they use our materials, we are making sure that they are getting that as well. We also have a lot of contact with seniors during various senior buildings within the city of Detroit. So we're getting it through that network as well, our information out. So we are clearly working with the city and all of our communities throughout the county. We are sending them, I think you all now receive those daily situational reports. We are sending those out to all of our communities. We're also, as for each campaign, so for our general public, we had a press release issued on Monday along with our written materials. We have a frequently asked questions document that we've disseminated. We've done that also with our employees. Then we're also having tailored messages to the city mayors, managers, township supervisors, all getting the same attachments, but then just a cover message saying, this is what we're doing. And and if you need anything where we can help you, let us know. We've also partnered with, as Sergio said, a number of community agencies to also get the material in their hands. We want the community to be saturated with information, to clearly understand the impact and how their role in minimizing the spread.
Yeah, I would like to emphasize the importance of the public information campaign. In any emergency, the first thing to break down is always communication. And I don't want people to discount the value of getting that information out to the people. Where a lot of people do look for those medical countermeasures, the vaccines and the drugs, at this point we simply don't have those. And so due to how fast the disease does spread, the best thing that we can do at this time is to slow down that spread for a few reasons. If we were to just allow everyone to get sick all at the same time, it would grossly overwhelm our medical system. It works out much better if once you get sick, there's open beds in a hospital to be able to go and be treated. At this point, treatment is just it's preventative care. There is no drugs that actually treat the disease itself, but to be able to get right, if we were if we were to do nothing and just allow
The likelihood would be that would be the end result if we weren't doing the preventative measures.
Yeah, we're trying to mitigate that. We're trying to prevent everybody from getting sick all at the same time.
And to also note, too, that while we do know that our seniors have been the hardest hit by this, that in other areas, the symptoms really can range just to mild, that everyone does not require hospitalization. A lot is really then self-isolating at home, like as if you did have the flu or a cold, you would just self-isolate at home and then get through this. So to stress that everyone does not experience the most severe of the symptoms.
Yeah, it's important to note that a lot of kids will get the COVID-19 and nobody will ever realize that they had it because it will present like a cold. They'll simply think that they had a cold, and then once it's gone, they will never realize that they had it, but they will be immune to it. So by slowing this down, we are developing a level of herd immunity, which is when a percentage of the population is immune to a disease. When COVID-19 hit the world, there was zero immunity to it, which causes it to spread very quickly. So the more we slow it down, kids can actually help a lot in that as they get it and become immune to it, those schools become areas where the disease doesn't spread anymore. So the more we can slow it down, the less likely the senior population is to get the disease, and also it gives more time to develop a vaccine.
Also, as part of our public awareness campaign, we know that written materials are good, but people sometimes want to talk to a live person. And we do know we have limited staff, so we have partnered with a nonprofit called the Information Center in Taylor, who is they're phenomenal, and they've been really underutilized, and they have dedicated a line to take calls about COVID-19, just for COVID-19. They do other call center functions and answer calls regarding other resources throughout actually Southeast Michigan, but they are partnered with us, and they're doing that initially at actually no additional cost to the county because they already existed. They have the infrastructure. So they will be available Monday through Friday, 8 to 5. So we know a lot of people, though, will want to still speak to someone outside of regular business hours. So we also are utilizing the 211 feature. Our staff have actually trained the staff who will be answering the lines at the Information Center, and we've gotten very positive feedback from callers who have used that. 211 also, their staff have been trained, and so the thing is that we will have 24/7 access for anyone who has questions and want to speak with a live person, other than if they want to call their own medical doctor or go to another facility. Also, for our employees, those who have Blue Cross, Blue Cross operates a nurses hotline. So we've also put that in our materials and information to our employees. So I believe to Mr. Basham's report that if we're talking about preventative and people are concerned, other than just saying if you do have a fever, that could be one thing, but they will be able to access and get direct information from a live person if they are really thinking they're experiencing symptoms, and does that really necessitate contacting a professional.
Okay, and on e-communications yesterday had all of this very well documented, so I will suggest that everyone please reread your e-communications from yesterday. It had the phone number for 211, the additional Wayne County phone number, the information about Blue Cross Blue Shield if you were an employee. So please read that information. It's very, very detailed, that you can share that with your constituents. And in lieu of the time, I'm going to go straight to questions because I think I want to get us out of here before 1 o'clock. Commissioner Baydoun.
Thank you, Madam Chair. I was at the press conference last night at the Dearborn Public Schools administrative building. So just to clarify some things, the teacher at that school that was shut down for right now, came supposedly in contact with that person, the one case in Wayne County, and that person supposedly, like Janelle said, did not show any symptoms. As a precautionary measure, the superintendent in the Dearborn Public Schools made the decision to shut the school down. Now they're waiting for the test results on that teacher, which will be available today at 5 o'clock. Should that test be positive, then they're going to have to go back and backtrack and see who that teacher was in contact with, is maybe students or other staff. Right. As a precautionary measure, they shut down the school, but I have a question on the symptoms. My understanding is for the first 5 days, you don't show any symptoms, and you could potentially transfer the disease or the virus to another person without you knowing that you had it. Is that your understanding, Sergio?
So the incubation period is 2 to 14 days, and there has been, let's call it anecdotal evidence. There's been messaging put out by China that they believe that it is possible to, within a couple of days from developing symptoms, to transmit the disease to others. That has not been confirmed by the CDC or the WHO at this point. So at this point, we simply don't know. It just hasn't been confirmed.
Okay, another question. This staff in Dearborn Public Schools who was tested, now that person was tested by Wayne County Health Department and sent to Lansing?
Actually, no, they were not tested. We do not take the swabs. I'm not sure who that staff person was tested by, but the results were sent to Lansing.
I was told that they're waiting to see from the CDC from Atlanta, Georgia. Is that the case?
So the state lab does the preliminary test. So when you saw that there, a couple nights ago, that there were 2 cases in Michigan and it said preliminary positive, that's because they had tested positive at the state lab. The state then forwards those samples to the CDC for confirmation testing.
I see.
And I think the terminology they used was presumptive positive, which was what was put out in the media, and I believe what the governor said.
Okay, thank you.
Commissioner Daub. Okay, Commissioner Haydos.
Thank you, Madam Chair. I know we all have the same concern. And I want to, before I start, I want to thank you for, both of you, for your presentation to the senior citizen in my district, in Romulus. It was excellent. People receive it very well. Education about anything would help to prevent or find a cure. As I appreciate Commissioner Basham when he really anxious to see the county doing what he see it's fit. But my problem with that is it's a huge problem, way bigger than Wayne County. It's a global. And I want to know if we have a real pressure and effort to get some federal assistance and state assistance in that area, then a small county or large county or city or, you know, the small government could deal with the assistance and help with this, the help of the state and the federal. Is any thing or strongly going to ask the federal and the state to help in those areas?
Yes, and I would say that we have been fortunate to actually have been contacted. I would tell you that Congresswoman Dingell had contacted the county executive earlier this month with regard to if there was anything, if we had any resistance with funding, and I personally spoke with her and been in contact with her at that level with regard to asking for funding. I know right before I came down, our chief of staff was on a call with FEMA, also asking, just telling our need is funding. Because one thing that Sergio did not mention is, while we have an emergency preparedness unit as part of our public health division, the funding they get is grant funds, but it's simply to actually have the infrastructure of the system, for us to have our staff, for us to have the pod system. It is not to actually respond to an actual emergency. So the money that we are spending now with regard to just printing costs, as well as buying the hand sanitizers, the disinfectant wipes, that's money that we've had to reallocate from equipment that was designated for his unit and from just other areas of the county. So that is where we're asking. I also had State Senator Adam Hollier. He has been very helpful, who reached out to say, what can he do to help us get funding? So that is the request that we keep sending up. We submitted an initial estimate early on before there were any cases in Michigan, and this was back in the first week in February. We did submit to the state, just giving them an idea of what we thought potential costs could be. So we have had this high on the radar. Again, we've had various congressional staff, state representatives, senators who have offered to help. And if we do, at some point, may even come to the commissioners to see if we could get your collective support in doing that if we have resistance. I will say that our initial request to the state to provide funding for the disinfectant wipes and hand sanitizer was denied. But I have brought that to the attention of Senator Hollier and to Congresswoman Dingo.
As a friendly recommendation, Madam the Chair, because you speak in behalf of all of us here, to start communicate with the Congress and the Senate in Washington and Lansing both, we strongly ask for assistance in this area. Therefore, we need more funding.
Senator Peters is actually convening a teletown hall this afternoon, or actually around 5 p.m., where Carol Osterberry, as our health officer, will be participating in that.
Thank you, Commissioner. I'll do that as well. I just received an email from the White House. They're having a call at 2 o'clock, and they've invited me to participate. So I'll see what they're saying. Of course, our congressional delegation, and forward that information to all of us here.
We appreciate that.
Commissioner Anderson.
Thank you. I just wanted to ask if the materials, is that available electronically?
Yes.
Because there's some information on there that we might share ourselves to our folks in our district. And also the senior materials that you were talking about with the enlarged print.
Yes.
Can we get some of those?
Yes.
Okay.
How
Even
about,
if
we'll
it's-
send it electronically to Pam Lane?
Yes.
Is that fine? Okay.
And
We'll send you everything
get
that we
those?
have printed now, which would be, we'll get you this presentation. Now, the presentation has been used more like we're presenting here. We did with the cabinet, we did it with all the other elected officials. So we haven't publicized all of that, but I don't know if there's anything in there that would be a problem with publicizing. And then we have the frequently asked questions. We have the pamphlet. I will make sure, I'll attach that as well.
Okay.
Great. Thank you.
Thank you. Commissioner Baydun? To that point? Mm-hmm.
On the material, do you have any material that has been translated, for example, to Arabic and Spanish?
We're having that prepared. What's the status? We are having the translation.
Okay.
We're
working on that, yes.
Yes, we are working on that. You can imagine, too, that when we started with this, the vendors are so limited, just even getting supplies. But yes, we are having them translated to Arabic and I believe Spanish.
And
is
the
our initial.
originals are in multiple languages. It's just our versions of it that are much more user-friendly are in the process.
Yes.
Okay, Commissioner Baker McCormick?
Thank you. As I indicated at our HHS meeting, my concern was about the prevention and additional cases and slowing down any additional cases. And so to that point, you talked about children getting the virus and then we wouldn't know it. So at the school where there, that one suspected case is, if the children have it, then they will then take it home, possibly to their parents, which would, again, spread the virus. And so I guess my issue is, at what point are we going to do some type of, at what number, I guess, is there a number where we would basically self-quarantine all of Wayne County? Or do you have in mind what will happen if there's more than 3-4 deaths? What?
Yeah, so that's a very good question, and that's a very difficult question to answer. That last bullet on the slide up there is called non-pharmaceutical intervention, which is what we're doing right now. Social distancing, closing schools, those are non-pharmaceutical ways of handling this. And when we try to think about those decisions, there's various factors that have to be weighed. So what is the public sentiment, the public level of fear? how dangerous is the actual disease to people in reality. And it's really difficult to say, to put a number on it. It's one of those things where it is just going to become obvious to everybody all at the same time. And that's one aspect of this. And the other aspect of this is that we do not act in a vacuum. Emergency preparedness is part of Wayne County, but we are funded by the CDC, and every decision, especially for non-pharmaceutical intervention, we're getting guidance from the CDC and from MDHHS from the state. So those decisions are made in a group and
Collaboratively.
yeah, collaboratively.
Yeah, it just seems to me that there would already be a plan, a number of cases that we would say, you know what, we need to shut down everything, because the more people move around, the more cases and the possibility of death. And I think that's
So I
something.
think our focus would be focusing on those who would be most vulnerable to it being fatal or having very extreme symptoms. And so I think that, as you say, when it started in the state of Washington, if you recall, it started in a nursing home, which they said that it wasn't surprising because in a nursing home, most of the residents had other underlying health issues, why it spread so fast. I think, too, that, Commissioner, that if you're saying that, as you say, we talk about this with our state partners, our federal partners, almost on a daily basis, and we are learning new information every day. And so we have thought about this when you start talking about the cascading effect and about that we would all just close up now, but we really believe that would be far too extreme. When you talk about the impact on the variety of the areas of the population, so we said we have to focus on those most vulnerable.
Right.
Yeah,
And so-
and,
Okay.
sorry. And to speak to that too, we work diligently even before COVID-19 came onto the world stage, but we can't pre-plan for a virus because every virus is different. If a virus like Ebola or SARS that are very deadly and very dangerous, if those became easily communicable, then our reaction would be much faster for things like social distancing. Everything would lock down immediately. But the death rate, I don't want to say that it's low, but it's not. We have to factor that in making that decision as well, because there's a tremendous economic impact on the community when everything shuts down.
Yeah, well, I'm having a couple of events coming up. One the end of next week, and then one next month. And I'm trying to figure out, should I just cancel them? Because I don't want to help to spread the virus. And
So in the governor's press conference yesterday, they did give some suggestions about minimizing events that have more, you're going to expect more than 100 people, minimizing, again, larger meeting, in-person meetings, things like that. So we're suggesting to following those, at least the guidelines that the governor has announced.
Okay.
The last thing I did want to say, though, is that, as we all know, this is new and evolving. But I would tell you that I believe we have a very sound leadership team on this. And we realize when we have to make a decision on any given time, we use our collective knowledge and judgment to make the best decision we think at that point in time. And I even had this talk with our team yesterday that I understand people are cautious and concerned that it'll be the wrong decision. I say that is why we're hired, though, to make sound decisions based on reason and facts, accurate information. If we have to change a decision going forward because we have new information, different information, we will still make the best decision. We will not be afraid to take a different course if circumstances warrant that. So that I can assure you.
Thank you, Janelle. Vice Chair Pro Tem Ware.
So are you making the decisions? Because, like, for example, I know that we have a public health officer, I don't know her title, Carol.
Carol.
She's good. But I know that at one point, the department itself, the Department of Health and Human Service and Wellness, is without a director and a deputy. Am I correct?
Technically, yes. But I say
So,
technically because I am overseeing
So
that
you're
department
making
now.
that decision?
Yes, collectively as a team. I'm not making a decision in a vacuum. Some decisions have actually been consulted with the Deputy County Executive and the Wayne County Executive. So I'm saying that just as a team, but yes, I'm performing the role of the HHVS Director while we are
Because I was in a
recruiting.
panic because I knew that we didn't have a director or a deputy,
I've been working very closely. In fact, we made a decision not to appoint an interim because none of our internal division directors had expressed interest. And to maintain stability in their areas, I work with the department. I've been there since they were formed. So it just gives me an opportunity to work even closer with them. So the division directors report to me now.
Thank you.
Thank you. As you know, this is evolving and changing every day. So I think you all are putting out a report every day. So please look in your emails for the reports every day that are coming through, because that's going to be a way to keep in contact. And of course, their doors are always open if you have a pressing concern or question that they can answer. Final comment, Commissioner Bedun.
Question. You said, Sergio, there's 11 cases that are being monitored. We know that one of those is the teacher in Dearborn. Are the other 10 cases, were they in contact with the 2 confirmed cases in Oakland and Wayne, or are those cases that possibly people who traveled from overseas?
It's the latter. It's people who, for any reason, could have come in contact with the disease. So it's not necessarily just people who have been in contact with
those 2 cases.
Okay.
Right. They may have also been in contact with somebody in Florida or California, or just have traveled to an area where it's prevalent.
And that number changes, if you all notice, because the incubation period is 14 days after the last possible point of contact. So that number, that's why you'll see that number fluctuate.
Okay, thank you.
All right, thank you again for your time. We look forward to just getting more information as more information is discovered and realized. And then, of course, we'll share that with our constituents. I'll say we have to remember that we have to think about facts versus fear. Facts versus fear. We don't want to cause a panic, but we do have hand sanitizer, washing your hands, all those hygiene, medical gloves, but all of the common sense hygiene things that we should be doing anyway. So thank you again for your time, and we look forward to continuing to get updated from you.
Thank you.
Thank you.
Thank you. Next item, Madam Clerk.
Item E, such other matters.
Any
as
such other matters? Next item.
Public comments?
Any public comments? Anyone from the public wishing to? We have one public comment. Thank you. We have one public comment, commissioners.
Good morning, Madam Commissioner, Madam Chair. Very nice to see you this morning. My name is Carmen Johnson. I just wanted to take a quick moment to greet you all. I am from Life Challenge, which is a one-year residential program, faith-based, here in the city of Detroit. We are not one of the members of our lovely DWIN community, but I wanted to personally greet our Commissioner Baker McCormick, and thank her for her kind words earlier. We are an organization that does not receive any government funding at all. So we are entirely donation-based, but we want to let you know that we are here for the community. We want to be on your radar. We are 1 year, and as Commissioner Basham alluded to earlier, the 30-day programs are not working for our people, and the 1 year has some wonderful results. So we want you to be aware that we're here, and we're here to help. So thank you.
Thank you. And if you could leave some cards for us as well. I did stop by your event during Commissioner Baker McCormick's event last year, and I was not aware that you even existed in the Wrighton neighborhood, and they are doing phenomenal work. So thank you for coming out. It's good information for us to have as a resource if we know people who need a one-year residential program. Thank you so much. Any additional public comments? Oh, no. Hearing none, next item.
Adjournment.
All right, thank you all. Meeting adjourned.
Yes. Yes, I was.
Oh, Lord. Commissioner Ware. Oh.